Good morning. My name is James Valentine, and welcome to the externally led, patient-focused drug development meeting on autosomal recessive polycystic kidney disease. I'm here in the studio with my co-host, Susan Bushnell, the CEO and president of the PKD Foundation, and we're coming to you live from the Washington, D.C. metropolitan area, not far from where the U.S. Food and Drug Administration's headquarters are located. It's my pleasure to turn it over to Susan to provide some opening remarks. Susan?
Thank you, James, and hello, everyone. Welcome to the externally led, patient-focused drug development meeting on autosomal recessive polycystic kidney disease, or ARPKD. My name is Susan Bushnell, and I'm the president and CEO of the PKD Foundation. Our mission is to fund research, advocate for patients, and build a community for all impacted by PKD. We also welcome the staff members of the U.S. Food and Drug Administration that are taking the time to be with us today. Thank you for giving us permission to hold this meeting. We're excited for this opportunity to highlight the voices of patients, parents, caregivers, and families impacted by ARPKD. Thank you also to our sponsors, the Stolper family and Otsuka Pharmaceuticals, for their generous support. We are motivated to see in attendance representatives from advocacy organizations, pharma companies, federal agencies, and research centers from across the world. Thank you for joining us today. Most importantly, I want to welcome the members of the audience whose lives have been directly impacted by ARPKD. Today's meeting is the result of many months of planning, promotion, discussions, and attempts to better understand the needs and various perspectives of the community we serve. I want to extend my sincere thanks to everyone involved, including the ARPKD CHF Alliance and the team at the PKD Outcomes Consortium. We are grateful to have this opportunity to ensure that patient and family perspectives are considered in the drug development and regulatory processes. ARPKD often manifests in utero, at birth, or in early childhood. It is characterized by the development of cyst leading to kidney enlargement and progressive chronic kidney disease. And it's just not a disease of the kidney. The liver is often affected by congenital hepatic fibrosis and portal hypertension. The spleen can be enlarged, and complications in utero can lead to poor lung development. As you will hear today, many living with ARPKD face declines in kidney and liver function, often leading to the need for transplant. Others experience failure to thrive and developmental delays. Despite the severe childhood impacts of ARPKD, there are no FDA-approved treatments to treat ARPKD, CHF, or prevent ARPKD progression. The unmet medical need is tremendous. The experiences of the families we know impacted by ARPKD are varied. We hope that you will remember the stories you hear today, and we hope that you will leave with an appreciation of the great need that exists for treatments that target the outcomes most important to these families. I want to express our appreciation to the researchers working in labs and clinics all around the world, striving towards a better understanding of basic and translational ARPKD science and moving us closer to future clinical trials. Our hope is that this meeting will encourage future research and successful new product development for people living with ARPKD who urgently need treatment options. For our ARPKD families, we invite you and your loved ones to call or write in during the program, and we ask that you stay with us and participate in live polling throughout the meeting. We want to hear as many perspectives as possible, and we'll do our best to get to as many of your comments as possible. When participating today, please only use your first name and state or country. No other identifying information should be shared. Be assured that any comments we are unable to discuss are still very important and will be included in the Voice of the Patient report, a summary of this special day. To begin today's meeting, I'm delighted to introduce our speaker from the FDA, Dr. Katirda Mistry. Dr. Mistry is a pediatric nephrologist in the Center for Drug Evaluation and Research at the FDA. Dr. Mistry will provide some opening comments from the FDA perspective. Dr. Mistry, over to you.
Hello, thank you for that introduction. Many of my colleagues from FDA are online today. On behalf of all of us, I thank you for sharing your stories and your experiences today. Today is about hope. This meeting is an important and critical step in the process of evaluating new therapies that are being developed and those that will be developed for treating autosomal recessive polycystic kidney disease. Important scientific advances and your efforts and advocacy, as well as the efforts of the larger community, have led to pharmaceutical companies developing products to treat kidney diseases, including rare diseases like genetic cystic kidney diseases. And so it's critical that we at FDA, as well as members from the pharmaceutical companies, developing treatments for you, hear from you regarding how we should move forward. It goes without saying that you, the patients with the disease, should be at the center of the drug development process. You and parents and caregivers of children with ARPKD are the experts in what it is like to live with ARPKD. I acknowledge that regulators, the medical community, drug developers, and others have not done a good job of placing you at the center of the drug development process and obtaining input from you. However, I'd like to think that we have begun and continue to work to rectify this. I'd like to share FDA's initiatives in patient-focused drug development with you. The overall intent of patient-focused drug development is to incorporate your voice in the process of drug development and evaluation. We try to do this systematically by listening and learning from you about what it's like to live with the disease, the aspects of the disease that bother you, that interfere with your daily lives and the lives of your children. Another aspect is hearing your thoughts about participating in clinical trials that are or will be conducted to evaluate new treatments, including what is acceptable and what aspects are burdensome or unacceptable. Another issue is the data that are needed to establish the safety and effectiveness of a drug for treating a disease. To obtain this data, we often require a placebo-controlled trial, meaning that you or your child could be offered a product being developed to treat your or your child's disease that may or may not be better than current treatments or current standard of care. Know that as relates to enrolling children in clinical trials, there are additional safeguards in place to ensure the rights and well-being of children in clinical trials. All of this can be challenging and should be discussed. We also want to hear about how you think about the trade-off between benefit and risk. What is acceptable? What's not? We want to hear from you. We've been fortunate to have had several patient-focused drug development meetings related to kidney diseases. So how do these meetings affect our thinking at FDA as we evaluate products being developed, and how does the information from these meetings inform our decisions? I think it's fair to say that many of us listen and connect to your stories on a personal level. Your stories remind us of the urgency with which we must act to overcome obstacles to drug development. It inspires us to do better and reminds us of why we are here We want to help you to find a way to treat the disease and to do so in a way that's meaningful to you. Successful drug development takes a community. You, the patients, parents, caregivers, academics, researchers, the medical community, pharmaceutical companies, patient advocacy groups, regulators, and others must work together. You are at the center of this process, and meetings like this are critical to provide perspective on what is most important to you. It is critical that you be involved in this process and that you encourage others to get involved. This meeting is a starting point for us to hear you. I encourage you to be involved and drive the process forward to encourage drug development in this space. On behalf of all of us at FDA, we thank you for sharing your stories and experiences. We are eager to hear from you, and we want to help. Thank you. And back to you in the studio.
Thank you, Dr. Mistry. Next up is Dr. Aram Hartung to provide a clinical overview of ARPKD that will serve as a scientific foundation for today's discussion. Dr. Hartung is a well-respected ARPKD expert and clinician scientist who serves in many leadership positions at the Children's Hospital of Philadelphia and sits on the PKD Foundation's scientific advisory panel. She is doing incredible work to develop new kidney and liver imaging biomarkers for ARPKD and other kidney diseases. She also serves as a research mentor to pediatric nephrology fellows in various research projects to train the next generation of specialists. Dr. Hartung, over to you.
Well, thank you for that kind introduction. I'm going to be providing a clinical overview of ARPKD to help set the stage for the day. These are my disclosures. So this is the outline of my talk. I'll start by giving an overview of ARPKD and then go through ARPKD's effects before birth and during the neonatal period, as well as its effect in the kidneys, liver, and in other organ systems. So ARPKD is rare, clinically variable, and genetically variable. So it occurs in about 1 in 20,000 births. So we estimate that there's probably around 1,500 children and young adults living with ARPKD in the United States. It is highly variable, so it can be diagnosed anywhere from the prenatal period all the way through adulthood. And we estimate that maybe about 1/3 of patients might present in the prenatal period or in infancy, and about 2/3 of patients present later in childhood or in adolescence. The severity of kidney and liver involvement varies widely, and we'll talk a little bit more about that later. And genetically, the vast majority of patients have mutations in the PKHD1 gene, but there's a very large number of different types of mutations described, so most people will have mutations that are perhaps unique to their own family. The spectrum of ARPKD is highly variable, so it can have effects all the way from before birth through adulthood. And there's a wide range of possible symptoms, and an important thing to remember is that not everyone affected by ARPKD has all of these things. And so there are certain things that are in common. For example, many people will have enlarged kidneys early in life, but kidneys don't necessarily continue growing throughout the lifespan. And so by adolescence or adulthood, people's kidneys can be normal size or even smaller than normal. Almost everyone will have bright or echogenic appearing kidneys with possibly some visible cysts on ultrasound. And almost everyone will develop decrease in kidney function. But again, the age at which that develops and how severe that is highly variable. In some severely affected infants, they can have problems before birth, including low amniotic fluid and underdeveloped lungs. And in those severely affected infants, there can be significant issues in the neonatal period, such as feeding difficulties and breathing problems. Sometimes low sodium levels, but many of those issues get better in infancy and don't persist later in life. High blood pressure is a very, very common symptom and can occur really throughout the lifespan. And the liver issues tend not to necessarily develop right at birth, but often later in childhood or adolescence. So before birth, ARPKD can be diagnosed based on ultrasound findings. So that can include large, bright echogenic kidneys, sometimes with some visible cysts. The amniotic fluids can be low if the fetal kidneys aren't working well, because the majority of amniotic fluid is composed of fetal urine. And the lungs can sometimes be underdeveloped if the kidney function is poor, because that amniotic fluid is needed for lung development. And so as a result, some severely affected babies can have breathing problems early in life and can require mechanical support. There can be feeding difficulties, particularly if the kidneys are very enlarged. And dialysis is sometimes needed sooner after birth. And occasionally, if the kidneys are extremely enlarged, doctors may consider removing one or both of them. So to hone in on what's happening in the kidneys, these top panels here show what normal kidneys might look like on ultrasound and in cross-section. And what happens in ARPKD is the kidneys are enlarged and have multiple tiny cysts scattered throughout that on ultrasound look like kind of bright, almost salt and pepper appearance, sometimes with a few visible cysts that might appear as dark circles, but otherwise the cysts are really too small to be seen by ultrasound. And in cross-section, this gives an idea of what that might look like. Everyone who has ARPKD will have what's called chronic kidney disease, which means some degree of dysfunction of the kidneys, but the age at which kidney failure develops is highly variable, and I'll go into some of that data in a second. So these graphs show some analyses from two different studies. Both of these are what are called survival curves or Kaplan-Meier curves. And what these both curves show, which I'll walk you through, is kidney survival, which means what proportion of people had not yet reached a requirement for needing dialysis or a kidney transplant. And so that's on the y-axis, and then along the x-axis is the age. So this left panel shows an analysis from the large ARPKD cohort, which is a registry in Europe. And they looked at kidney survival in the first 3 years of life. And you can see that in the first few months of life, there's a bit of a steep curve where some babies will have kidney failure quite early. But again, that's only about 5% of babies in the first few months of life. And then after that, the curve becomes gentler. So by a year of life, about 90% of people will still have some degree of kidney function. And by 3 years of life, about 85% of people will have still some degree of kidney function. On the right side, this shows an analysis from a cohort that was assembled at the NIH. And this shows the kidney survival through adulthood. And so you can see that in that cohort, at around 20 years of life, still about 75% of people had some degree of kidney function. Now, if we think about risk factors for what causes more severe outcomes, one of the main things is really what age people present. And so among the babies who are diagnosed in the prenatal period, unfortunately, even with modern medical care, about 15 to 30% of those infants, unfortunately, don't survive. And that's primarily due to that lung underdevelopment that I talked about later. In those babies, the kidney outcomes also tend to be a little bit more severe. And so on the right here is again data from that NIH cohort that I showed on the last slide. And now that kidney survival is divided to show you the differences between infants who present in the perinatal period versus those people who were diagnosed later in life. So you can see that among people who were diagnosed at the perinatal period, at 20 years of life, about 50% of those early presenting people had reached the need for dialysis or kidney transplant, whereas still about 85% of people who had presented later in life still had some degree of kidney function. Some other factors that we know that affect the rate of kidney disease progression in ARPKD, if we hone in on prenatal ultrasound findings. So again, not everyone who is diagnosed with ARPKD prenatally is as severe as everyone. So there is, even among that group, there are some factors that might make you at higher risk for more severe abnormalities. So if the kidneys appear normal and there's no abnormal amniotic fluid on prenatal ultrasound, those babies only have about a 1.5% risk of needing dialysis by 1 year of life. Whereas if babies have low amniotic fluid and large kidneys and kidney cysts on prenatal ultrasound, about a third of those infants will require dialysis by a year of life. Some other factors that influence kidney survival are different types of mutations, so more severe null mutations, meaning mutations that lead to loss of gene function are associated with worse kidney survival. And then kidney size, very early in infancy, infants with very large kidneys do have worse kidney survival. But like I said earlier, kidney size later in life does not necessarily continue to enlarge, and so that's not necessarily predictive of outcomes later. Some other kidney-related issues that individuals with ARPKD can experience. One is acidosis, or the inability to get rid of acid from the body through the kidneys. As I mentioned earlier, some babies will have low sodium levels in infancy, and that tends to get better over time. Many people will have a urine concentrating defect, meaning they make large amounts of urine and may have issues like bedwetting or frequent urination. And urinary tract infections are also fairly common. Now, outside the kidneys, far and away the most important issue that we deal with is hypertension or high blood pressure. This is extremely common and occurs in the vast majority of people with ARPKD, and sometimes can be very difficult to control, particularly in infants. And if hypertension is not well controlled, that can lead to heart problems such as left ventricular hypertrophy or thickening of the heart muscle. There is also a possible association with blood vessel abnormalities such as aneurysms, and that's an area of active research right now. And then, of course, in addition to the ARPKD specific effects, in people who have diminished kidney function, there's a number of other issues that are common to everybody who has some degree of chronic kidney disease, such as anemia, bone health impacts, and issues with growth or learning. And finally, to talk about the liver involvement of ARPKD, that's an entity known as congenital hepatic fibrosis, and that consists of three main issues. So the first is dilation of small bile ducts inside the liver. The second is scarring within the tissue of the liver. So on a microscopic level, there's what's called fibrosis in the periportal areas, and that leads to stiffening of the liver. And then finally is something called portal hypertension, where blood that's supposed to be flowing from the internal organs, such as the spleen and esophagus and stomach, has a hard time getting back through the liver and can cause high blood pressure in those organs. And the severity of liver-related symptoms, similar to the kidney, is highly variable, and there's no clear relationship between the severity of kidney and liver disease. And so this table just illustrates the spectrum of what people can experience as a result of ARPKD-associated congenital hepatic fibrosis. So some people will have no symptoms whatsoever, and so they have normal imaging, normal lab findings, and no clinical issues whatsoever. Some people are mildly affected, where maybe they might have some things visible on ultrasound, like dilated bile ducts, or maybe slightly irregular looking liver tissue. They might have some mild lab abnormalities, but again, may not have any symptoms that require treatment. And then when you get into patients who have more moderate or severe disease, they can experience symptoms, complications such as infections of the bile duct called ascending cholangitis. That portal hypertension can lead to low platelet counts and low white blood cell counts. They can develop a complication known as esophageal varices, which are dilated veins in the esophagus and stomach, and may experience bleeding. And patients who have very severe or recurrent problems with this may need surgical intervention, such as initially may be able to be treated endoscopically to treat those bleeding varices, but in more severe cases, people may need shunt surgery to divert blood from the liver, and some proportion of people also will require liver transplantation. So some of the key take-home points are ARPKD is a highly variable disease. It can present anytime from birth to adulthood. Its main impacts are on the kidneys and liver, but there's, of course, many other important considerations to take into account in the care of individuals with ARPKD. So I hope this provided a good background as we delve into our discussions today, and I look forward to hearing all of our patient voices throughout the day today. I'll hand it back to the studio. Thank you.
Thank you, Dr. Hartung, for that wonderful overview. I'd now like to welcome our moderator for today's meeting, James Valentine, who has been working with us over the past several months as he's helped us plan this meeting. He has worked for the last 15 years as a champion for the patient voice as part of the regulatory process. James previously worked at the FDA, where he was a patient liaison, helping to incorporate the patient voice into medical product review across the FDA's various medical product centers and review divisions. There, he helped to develop and launch the Patient-Focused Drug Development Initiative. Now in private practice, James continues to work with many patient organizations to ensure their community's voices are heard by decision makers. James and his colleague Larry Bauer have been involved in helping plan and moderate many of the over 77 externally led PFDD meetings held to date. So we are in good hands with James.
Oh, well, thank you so much, Susan, and it's so wonderful to be here with this ARPKD community, and I'm looking forward to engaging with you all throughout today's program. So, now that we heard a disease overview from a clinical expert, we turn to the core of today's meeting, which is to hear from you, people living with ARPKD and their parents, spouses, and other direct caregivers. Patient-focused drug development, or PFDD, is a more systematic way of gathering patient perspectives on their condition and on available treatments. As you heard from FDA's Dr. Mistry, your input can help inform the agency's understanding of ARPKD to inform drug development and review. While FDA has held many of its own PFDD meetings, today marks the 77th externally led patient-focused drug development meeting. With over 10,000 known rare conditions, this is a truly unique and important opportunity for this community to be heard. Today's meeting is interactive, so let me tell you a bit about what we'll be asking of you and how today's meeting will be organized. In our first session this morning, we'll be exploring the patient and caregiver experience with living with ARPKD and its impacts on you and your loved ones' daily lives. Then, in our second session this afternoon, we'll bring everyone back together to explore the various approaches to treatment, including participating in clinical trials, and we'll be asking for your preferences for future treatments. So, what will these morning and afternoon discussions look like? Well, today we'll be using primarily 3 different methods or ways to bring your voices into the discussion. For each of our 2 sessions, we'll start by hearing from a panel of patients and caregivers of individuals with ARPKD. These panel testimonies will set a good foundation for the discussion, and the experiences represented on the panels are reflective of a range of experiences with ARPKD. But we know no single or couple of panels can reflect the full range of experiences, which is why we'll then turn to all of you in our audience and have a facilitated audience discussion where we'll ask all of our patients and caregivers who are tuned in to build on what we heard from our panels and share your experiences. I'll be asking questions and inviting you to call in and write in with your experiences. I'll ask you to state your name and provide your comment. Again, this can be done in one of 2 ways. We'll ask for you to dial in by phone, and I'll be sharing that number a little later in the program, as well as by submitting written comments on the webpage you're following along today. I also note that we'll have a Zoom panel of patients and caregivers who will be joining and sharing perspectives as well during that audience discussion. The third way is we're going to be broadening our understanding of the experiences of those in our audience through the use of polling questions. We'll be asking patients and caregivers only to use your phone or open up a web browser to respond to these questions. You can actually go ahead and get into this system now. Because once you're in, you'll be able to stay here throughout the entire day. You can just go back to that browser on your phone or that browser tab on your web browser on your computer. And at this time, I'd ask that you go ahead and do that and go to www.pollev.com/ARPKD. Again, feel free to go there now, www.pollev.com/ARPKD. We'll get to polling very soon, but we want to go ahead and give people a moment to get into the system before we get there. We'll be using these polling questions to broaden the discussion to allow everybody in our live audience to participate. And these are really intended to aid in the discussion. I want you to think as you're answering these different polling questions about why you're making the different selections. And then I would encourage you to call in and write in to reflect on that. There will also be an opportunity to provide written comments for 30 days following today's meeting. All of today's input and any subsequent written input will be summarized in what's called a Voice of the Patient report, which will eventually be provided to the Food and Drug Administration and made available publicly for researchers and drug developers and anyone else in the community to access. Before we get to the first set of polling questions, I do want to cover a few ground rules. I want to encourage people living with ARPKD and their parents, spouses, and other direct caregivers to contribute to the dialogue. Again, you can do this through polling questions, calling in by phone, and submitting written comments. The discussion today is limited to patients, family members, and other direct caregivers with ARPKD. Meanwhile, our colleagues at the FDA, at drug development companies, our clinicians and researchers are here to listen. I also want to mention that views expressed today are inherently personal, and the discussion may get emotional at times. So respect for one another is truly paramount. And to that end, I do ask that you try to be focused and concise in your comments so that way we can hear as many voices as possible. So without further ado, let's get into our first set of polling questions. These are a set of polling questions to give us a sense of who we have in our audience today. Again, these questions are limited to those individuals living with ARPKD, as well as their caregivers, family members, to answer and respond. And if you haven't already, again, you can go to www.pollev.com/ARPKD. You can do this on your computer, on your web browser, as well as you can alternatively do this on your phone on a browser if you prefer to follow along there. Again, once you get into the system, we want you to just keep this up throughout today's program. This will give you an opportunity to see when new questions are being put up for you to respond to, and you'll be able to do those as soon as they appear on your browser. So our first question today, this first set of questions you'll see is fairly simple. It's, again, to get a sense of who we have in our audience. The options here are you A, someone living with ARPKD, or B, a caregiver of someone with ARPKD. So we'll give a few more moments just to make sure everyone gets into this system. Again, it's pollev.com/ARPKD. As it stands, it looks like roughly about 20% of our audience is represented by individuals actually living with ARPKD themselves, and about 80% of our audience are those who are caring, family, whether that's as family members, parents, spouses, or just other, extended family and close friends. Anyone that, sees the impact of ARPKD in daily life, we want to encourage you to be an active participant in today's dialogue. If we can move to our second polling question. So here we want to know where do you currently reside. So the options are A, the U.S. Pacific time zone, B, U.S. Mountain Time, C, U.S. Central Time, D, U.S. Eastern Time, E, U.S. Alaska Time, F, U.S. Hawaii Time, G, Europe, H, the Middle East, I, Asia, J, Canada, K, Mexico, or L, some other country or region not reflected in the other response options. And we'll give everyone a few moments here to get their responses in, so that way we can track your responses throughout today's program. So as it stands, it looks like about half of our audience is in the U.S. Eastern time zone, but we do have a good range of participation across the major U.S. time zones, including the U.S. Central, Mountain, and Pacific times. As it usually goes, we'll probably expect those further west time zones participation to pick up as the day goes on. We're going to move to our next polling question. So here we want to know, is the individual with ARPKD, so if this is you, if you're the person living with it, or your loved one, if you're a caregiver, are they A, female, B, male, C, non-binary, D, prefer not to identify, or E, other? So again, we want to know, is the individual living with the ARPKD, whether that's you yourself or the person that you care for, A, B, C, D, or E? I see results are still trickling in here. It's bouncing around about 50-50, sometimes female, slightly, higher number of responses, sometimes male. But we're seeing a pretty close breakdown. All right, if we could move to our fourth polling question this morning. So here we're going to know how old is the individual with ARPKD. So this is, again, either you yourself or a person for whom you care with ARPKD. The options are A, 0 to 6 years of age, or 0 to 1 years of age, B, 2 to 5 years, C, 6 to 10 years of age, D, 11 to 18 years, E, 19 to 30 years of age, F, 31 years of age or older, or G, unfortunately, the individual impacted by ARPKD has passed away. And if you are one of the individuals selecting G here today, the person for whom you cared, your loved one with ARPKD who's no longer with us, we do encourage you to answer all of the polling questions and participate actively in the meeting. Obviously some things are posed as looking towards the future, and so you can still answer those questions as what would have been relevant to your loved one prior to their passing away.
James, can I just add that we expect to hear mostly from parents with children in that age range of 0 to 10 years. When we do see the older ranges, it's a testament to how far our understanding has come. And as children get older, we do expect different challenges than infants or toddlers have experienced.
Sure. Thank you so much, Susan. And we do really encourage all age ranges reflected here, which we have a great a spread, truly, as we're seeing it. Every single age range is represented and fairly equally, maybe a slight bump for the 6 to 10 year group. But we want to hear about those experiences, and for those who, the people with ARPKD a little bit older, we want to hear about those experiences over time living with ARPKD. So we move to our last polling question for this portion of kind of demographic polling questions. We want to know here, what are your recent kidney function values? The options here, so this is for you, or if you're living with ARPKD, or if you know that for your loved one living with ARPKD. A, GFR greater than 90, B, GFR of between 60 to 90, C, of a range between 45 and 59, D, a GFR range between 30 to 44, E, range of 15 to 29, or F, a GFR less than 15, or G, if you don't know a recent kidney function value, either for yourself or your loved one living with ARPKD. So we do see a number of people who don't know their recent kidney function value. That's okay. It looks like beyond that, maybe the slightly higher representation of those in the 45 to 59 range and the 15 to 29 range. But we do see pretty good representation across all kidney function value ranges here. We do want to hear about experiences at all points in the progression of this disease. So we're very glad to see good representation in all value ranges. So with that, I'd like to now move into our first session for today. This is our first topic on what it is to live with ARPKD. And if we can pull up our first set of discussion questions, I'd like to walk us through and talk about some of the different things we want to explore with you in the remainder of our time together this morning. So in this session, we're going to be asking you to reflect on some of these things. We want to know about the different symptoms and health effects of ARPKD. Not only do we know about the range of them, we just saw a number of them or we're going to explore, the range of them that you have, but we also want you to think and reflect on maybe what 1 to 3 of those things has had the most significant impact on your or your loved one's life. We know that these different symptoms and health effects can change, be variable, and so we know that from day to day they may be a little different. So one way we'd like to explore that is to ask you to reflect on how ARPKD affects you and your loved one on best days versus worst days. We also know that these symptoms and health effects change over time. And so we'd ask for you to reflect on what are those changes that have occurred over time, and even how has your ability to cope with those changing symptoms over time looked like. We want to know not only what are those direct symptoms and health effects of the condition, but we also want to know what that looks like and what that means for your daily life. So are there specific activities that are important to you or your loved one that you can't either do at all or as fully as you would like because of ARPKD, CHF, or other related conditions? And finally, knowing that while everything up to this point that I've listed is asking you to reflect on what ARPKD, how it's impacting you today and in the past, we also know that people living with ARPKD and their caregivers are thinking about what life with this condition is in the future. And so we want to hear from you about what do you fear the most as you or your loved one gets older living with this condition, and what worries you the most about your loved one's condition in the future. So to get us started on all of these topics, it's my pleasure to introduce our first panel of the day. We have Lisa, Lindsay, Kelsey, Beth, and Julie who will be sharing their experiences. Lisa, take it away.
Good morning. My name is Lisa, and these are our daughters, Jana and Chesley. Our oldest daughter, Jana, was born a healthy 7 pounds, 12 ounces in July of 2010. She was a beautiful and sweet baby, and we thought had no physical problems. At 2.5 months, she began to have multiple urinary tract infections and terrible fevers. She was hospitalized several times and had multiple tests done, but the doctors were inconclusive. She seemed to outgrow the infections, but always had multiple unexplained fevers each year. In September of 2012, we had our healthy son, Dougie, and in May of 2014, our sweet daughter, Chesley. At Chesley's 2-week checkup, the doctor also performed Jana's preschool physical. During the physical, our pediatrician found a small lump in Jana's abdomen. She was 3. She had no signs of being sick. An ultrasound found her kidneys to be larger than in adults and fibrosis of her liver as well. She was then clinically diagnosed with Autosomal Recessive Polycystic Kidney Disease and Congenital Hepatic Fibrosis. Her blood pressure was double what a child her age should be, and the left side of her heart was enlarged. In January of the following year, through genetic testing, the diagnosis was confirmed. Genetic testing also revealed our younger daughter has ARPKD as well. Our son was found to be a carrier of the gene and can pass it on to his own children.
I'm now on 10 different meds a day, including 4 blood pressure meds and growth hormone shots. My little sister Chesley takes 4 pills a day. We have yearly ultrasounds and MRIs, quarterly blood draws, and lowered immune systems. We both have a team of specialists including nephrology, GI, cardiology, neurology, endocrinology, dermatology, and in the past, PT and mental health. I'm limited to many activities that I wish I could do, such as jumping horses and riding roller coasters that have lap bars only. It's pretty common for me just to not feel well and not really feel like eating much. The doctor appointments are tiring and depressing. I get very tired easily, which stinks because when my friends want to hang out, I want to hang out with them, but due to my kidneys, I'm just usually too exhausted. I really want to be a veterinarian when I grow up. I'm trying really hard to get good grades. I'm in advanced math and I'm taking college credit plus courses. I'm very smart and study hard in all of my classes. However, that might not even be possible to achieve my goal after getting new kidneys and liver. When I get my transplant, I won't be able to see my chickens and pigeons for a year or more, which will be really sad. The medicines I have to take have a ton of side effects that affect our quality of life, including headaches, nausea, dizziness, and I have even fainted several times. Recently, I had a seizure test, and the doctors found out that I may have had a stroke when I was little that can cause me to have fainting spells. I was in a wheelchair for 4 months because of my hypermobility issues, which many other parents of kids with ARPKD have said their kids also have. After 8 months of land and water therapy, I still have pain in my body, and at times all I can do is try to cope, because I can't even take ibuprofen for muscle and joint pain like people without kidney disease can. My body seems to have pretty bad body temperature control as well, something that the kidneys help with. I get really hot in the summer and really cold in the winters. Taking 12 pills a day is hard to remember to do, and then I have to make sure I eat with them, and I still get sick to my stomach almost every single morning and night of my life. I know all of my medicines by name and am very responsible and mature. I lost a bit of my childhood because of this disease. We all did.
I've never known a life without having giant kidneys. I go to the doctor a lot and get a bunch of blood draws. I always try to be tough when I have to have blood draws and scans. Sometimes my parents buy me ice cream afterwards, so that helps. Some things that I can't do since I have big kidneys, but I've always dreamed of, are gymnastics, and my true love is birds. My dream is to work with birds when I get older. I study their habitat, diet, language, and I love to learn as much as I can about them. When we went on my sister's Make-A-Wish trip to the Florida Keys, we got to see a bird training show, and it was like a dream for me. We have 7 chickens and a bunch of pigeons at our house from our family 4-H projects. I love to take care of them, watch them fly, and interact with each other. But I may have to find them a new home when I get my kidney transplant. The hardest part about having ARPKD is always having to worry about my kidneys. What I'm allowed to eat and not eat, remembering to take all my medications and all the blood draws and tests I have to get done each year.
Hello, my name is Lindsay Schwartz. In the fall of 2010, in the 3rd trimester of my first pregnancy, a routine ultrasound discovered that both of my son Stephen's kidneys were large and echogenic, and I no longer had any measurable amniotic fluid. The doctor delivered the devastating news that Stephen likely had ARPKD, and without amniotic fluid for the remainder of my pregnancy, he would not survive. We were referred to a maternal fetal medicine doctor who confirmed the suspected diagnosis of ARPKD, and so began an emotional journey over the next 2.5 months to find answers and a solution to ensure Stephen's survival. If Stephen survived birth with adequate lung function, he would have a double nephrectomy and live on peritoneal dialysis until he was big and healthy enough for a kidney transplant. Stephen was born on January 4th, 2011 via emergency C-section. Despite living in my womb for an estimated 15 weeks without any amniotic fluid, Stephen was born with fairly good lung function. He required CPAP, but no intubation. However, his abdomen was enormous from the enlarged kidneys, liver, and spleen, and they were taking up the space his lungs desperately needed to expand. His medical team planned for a double nephrectomy 6 days later. At the same time his kidneys were removed, a G-tube was placed in his stomach and a PD catheter was placed in his abdomen for dialysis. But Stephen faced an enormous uphill battle ahead of him. During his 59-day NICU stay, he dealt with pulmonary hypertension, blood pressure issues, a heart murmur, multiple infections, issues with normalizing his PD, feeding, gastronomy issues and constant reflux, and concerns with his fine and gross motor skills. These issues would continue well past his NICU stay and plague him throughout the next 2.5 years until he qualified for a kidney transplant. Stephen spent his first year of life in and out of the hospital, including an additional 4 surgeries to repair hernias, put in a Mediport for blood draws and IV access, and to replace his PD catheter. He spent every night on dialysis for 12 hours and was fed via G-tube 3 times a day and overnight. It took an entire year for his body to normalize to the PD and for him to sleep through the night. He didn't take his first steps until he was 1 year and 10 months old. The following year was spent preparing for transplant, which finally occurred on May 9th, 2013. A family friend donated her kidney to Stephen in an almost identical match. Fitting a kidney from a 6-foot-tall woman into a little 2-year-old boy was a miracle in and of itself. Stephen struggled immensely during his recovery. He had issues with anesthesia and pain medication and spent 13 days in the hospital recovering. But once we were discharged with his new large cocktail of medications, things started looking up. Stephen could finally take a bath. He could sleep without being hooked up to a dialysis machine all night long, and he'd finally be able to go to preschool and maybe start feeling well enough to eat solid food. Since transplant, there have been many struggles, and those struggles ebb and flow each year. It's so crucial for people to understand that transplant is not a cure. It's a treatment. And this treatment has very real and very scary side effects, physical, mental, and emotional. Stephen is now 12 years old and just celebrated his 10-year kidney transplant anniversary. It's an incredible milestone. But he's also currently undergoing treatment for donor-specific antibody-mediated rejection. It's confusing and hard for a 12-year-old to understand why he needs to do this treatment and why this is happening to him. Because of his ARPKD, Stephen also has adrenal insufficiency, meaning he does not grow like a normal kid. He's small for his age, and at a time when other boys are shooting up like weeds, he is not. He takes a growth hormone injection every night, but it's a very slow and long process, and it took months of exposure therapy and years of coaching for him to be comfortable enough to handle the daily injections. There are other physical appearance differences that are hard for him, such as having stained teeth from years of iron supplements and tube feeding, and a plethora of scars across his abdomen. Lastly, Stephen has also been diagnosed with ADHD. While I can't prove a correlation between ARPKD and ADHD, I wholeheartedly believe his cognitive function was impacted by all of what he's been through related to the ARPKD. Despite all of his challenges, Stephen's living his best 12-year-old life. He rides the bus to school, attends the same classes as his peers, plays sports, loves cars, and his dog. Without knowing his past, you'd have no idea this boy has braved so much in his short life.
My name is Kelsey Larson, and I am the mother of an ARPKD warrior. In a dark room in April of 2020, a masked medical team nervously told me that my unborn child had a single-digit chance of living more than just a few hours at birth. My life was instantly changed forever. My husband wasn't allowed to be in the room with me, and for the 7 months prior, I had been repeatedly told my baby was perfect. Perfect size, perfect heartbeat, perfect blood work, perfect growth curve, and boom, like a thief in the night, Kai wasn't going to live. The following 2 years of his life were nothing short of traumatic. I don't know how many of you have ever come across a baby on dialysis, but let me tell you, it's horrific. After spending nearly a month on a ventilator and 3 months inpatient, we were finally able to bring him home. Peritoneal dialysis requires intense training of the parents, and I was tasked with connecting and disconnecting Kai's dialysis cycler every night. I was the masked medical staff that made him cry. I was the one hovering over this sweet crying baby, shushing him and repeatedly singing songs of comfort because I couldn't pick him up to hold him during drain cycles as he cramped and writhed with discomfort. Kai vomited every night. He vomited every day. He would smell something from across the room and vomit. He would get the hiccups and vomit. Too many tickles? Vomit. Something would make him cry and he'd vomit. Medical providers are told that ondansetron is the best remedy for nausea caused by peritoneal dialysis. But let me tell you, it did nothing. And you'll never understand how many tears the parents of these children cry over empathy for their baby's suffering. Parents collaborate with ideas on Facebook groups, and ultimately they just pray for each other, empathize, weep together, and share products to catch the puke when it inevitably happens again and again and again. We dosed Kai with max levels of lansoprazole, omeprazole, famotidine, any other antacid we could get our hands on to fight the burning in his throat that would still come often, sometimes with small amounts of blood in his vomit. On his second birthday, I remember doing some quick math to calculate that he had vomited upwards of 7,000 times in his short life. We suffered and waited with Kai for what felt like an eternity until he matched with a deceased donor for a kidney and liver transplant. Over the past few years, we have had the privilege of finding friends and the parents of other ARPKD babies with similar severity to Kai. They have become our community of support and truly our families. We commiserate during the late night tears and wakeful hours when everyone else is fast asleep. I was able to find comfort with these families, and this was often the only way I was able to truly discover which of Kai's symptoms fell within normal range that was so often discussed in medical appointments. I specifically remember addressing Kai's chronic itching with his medical team. Again and again, I would insist that his itching was abnormal. It was excessive. It was far beyond what they described to be routine for a child on peritoneal dialysis, and they continued to reassure me it was typical for kids like Kai. They would carefully watch his potassium and phosphorus because high phosphorus can cause itching, but this was just next level for us. I took photos. I described the clothing I had to dress him in. I mean, really, we live in Phoenix, Arizona, and my baby lived 24/7 one-piece long-sleeve romper with second layers of pants and scratch gloves over that to physically protect him from scratching his body. Sometimes he would wiggle free from his gloves and shred his belly with his fingernails. I would wake up to screaming at 3 a.m. and would discover bloody fingernails and a sheen of red coating his blankets and sheets. It wasn't until Kai was 2.5 years old that his dermatologist moved to another facility and we were reassigned to a medical assistant or to a nurse practitioner who had just recently heard the injection Dupixent was recently approved for kids under 6. Dupixent is typically a beta blocker for severe psoriasis. He had a history of extremely mild eczema, and we had previously tried triamcinolone, fluocinolone, clobetasol, with very little relief. So we went for it. The steroid creams hadn't helped, steroid ointments hadn't helped, so we went for Dupixent, and it changed our lives. In a matter of hours, I was able to change a diaper without pinning Kai's arms down with my feet to prevent scratching. He was suddenly able to wear short sleeves, single-layer clothing. No one had ever discussed this with us before, and I wanted to shout it from the mountaintops that he was actually able to find so much of this needed relief with Dupixent. What's fascinating here is that now, post-transplant, Dupixent hasn't been very useful. It was only when he had no kidneys and a liver that was prone to cholangitis that this was so helpful. I would love to see someone study this in the future. It's really hard to put an entire experience into a brief summary, yet I am grateful to be a part of this panelist group. I hope that together we can improve the lives of future families suffering with their child through ARPKD.
Hi, my name is Beth, and my husband Mike and I are the parents of Eric, who would be 19 years old now had he not died of complications from ARPKD right before his 10th birthday. For many years, we never tried to have more children due to the 1 in 4 chance of having another very sick child. That changed when we learned about the option of IVF with pre-implantation genetic diagnosis, or PGD, to essentially ensure the baby would not be affected. Our son John is now a healthy 12-year-old. My 9-year-old daughter was a huge surprise, born less than a year after Eric's death, and thankfully she's not even a carrier. Although it had been a normal-term pregnancy and non-complicated birth, Eric immediately became critically ill. His kidneys were so enormous that his lungs were unable to expand and he could not breathe. Those massive kidneys barely functioned, and Eric developed life-threatening hypertension and electrolyte imbalances. It made our hearts ache, not being able to hold him at all for the first few days, and it made our hearts break that we could not alter the course of this brutal disease. It felt like a miracle when Eric came home from the neonatal ICU in just under a month. We loved feeling like we were finally getting to know our baby Eric. Finally, we were in our home where no one referred to him as a patient or a case. Not that we needed to be reminded, of course. His bedroom did resemble a hospital room with equipment for dialysis, tube feeding, vital signs, dozens of medications. It was wonderful to be home, but it would not be long before we were basically living in the hospital again. Eric's kidneys continued to grow, causing him incredible discomfort. They also continued to fail, so both had to be removed. It was the first of several major surgeries, leading to his successful kidney transplant at age 13 months. In Eric's case, the new kidney really did result in a new and wonderful life for all of us. Eric thrived for many years following the transplant. He was closely monitored by at least 5 specialties, and he participated in annual visits to the NIH for the ARPKD longitudinal study. During this time, we grew very concerned about his liver. Although his football-sized diseased kidneys had been removed, his belly was still distended because of an enlarged spleen due to advancing portal hypertension. From birth, we were warned that trauma to the spleen could be life-threatening. Unfortunately, this was not the only life-threatening concern. Eric also had esophageal varices that could bleed at any time. He had problems with his bile duct that could lead to cholangitis, which is a life-threatening infection. And he had blood clotting dysfunction and several other liver concerns. He was referred for a transplant, but ultimately his team at Stanford decided not to proceed because of how well he appeared at the time. The protocol we agreed to with his team was that we would not be listed for a liver transplant until he either had cholangitis or a large GI bleed. But a year prior to his death, Eric had 2 hospitalizations for UTIs with sepsis that caused significant ascites or fluid accumulation. Definitely the liver not working right. Because he did recover and his main liver function labs were fair, the team did not feel it was time to list him. However, it was apparent to me that the liver was not functioning well, as evidenced by the massive fluid accumulation. It was very slow to resolve. It caused a lot of complications, and I was scared. Unfortunately, Eric also had increasing anxiety and behavioral disturbances at this time. He often had wounds from procedures or just playing hard. At one point, he picked at a wound in his abdomen, and that turned into an emergency. There were some medication changes made in an attempt to decrease these dangerous behaviors and make him feel better, but that also included altering his immunosuppression regime. And very sadly, I feel that this is what ultimately led to his death. After almost 9 years of essentially no major kidney complications, Eric developed post-transplant lymphoproliferative disease, or PTLD, a form of lymphoma. Although the lymphoma occurred as a result of immunosuppression following Eric's kidney transplant, it was absolutely the advancing liver disease that made it so he could not tolerate the chemotherapy. In reflecting, our day-to-day was frequently challenging, unpredictable, packed with interventions, appointments, therapy, and the truly full-time jobs of managing prescriptions and insurance. We normalized and embraced our experience as a family, but the stress was overwhelming at times. The worst days were when Eric was in pain or anguish from the effects of his disease. Eric also had some unique behaviors and autistic-like tendencies that required a lot more supervision than a typical child. For several years, most of our energy and action was directed at managing day-to-day functioning. In considering the impact, the big picture is that we were able to love and care for this beautiful soul for almost 10 years. Eric was an extremely unique kid who left an incomparable impression on everyone he knew and many, many folks he never met. Thank you.
Hi, my name is Julie and I live in Connecticut. I'm a mom to 3 children. My oldest, Jordan, is 9 years old and does not have ARPKD. My boys do have ARPKD. Jameson is 5, and this is where our story is a little bit different than some others. My second child, Porter, died from complications of ARPKD. We found out that he had PKD during our anatomy scan when I was 19 weeks gestation. The doctor told us that his kidneys were enlarged and echogenic. When I was 30 weeks and 6 days, the ultrasound showed that he was in distress and we had to have an emergency cesarean section. By this point in the pregnancy, his kidneys had grown and lost too much function, and despite trying, there was nothing more the team could do. He survived for a few hours before we lost him. If we didn't have this history, we would still have no idea that my third child had ARPKD. We first found out when we were 23 weeks pregnant during an ultrasound scheduled specifically to look and see if he had signs of ARPKD given our history. During this ultrasound, his kidneys looked slightly enlarged and echogenic, and these were the first symptoms that we assumed meant he also had ARPKD. We later had confirmation through genetic testing. His kidneys continued to grow during the pregnancy, but not as quickly as Porter's had. We kept measuring with lots of extra ultrasounds, and he was born at 37 weeks. Since then, every hiccup begins a game of ARPKD, normal, or something else. When he was an infant, we had to call early intervention, unsure if he was unable or unwilling to roll over when he should have been able to. Was his stomach too big due to his kidneys? Did it not allow him to roll over? Did it hurt when he tried? Would he be delayed on all of his motor skills after this? The verdict they gave us was that he didn't want to, which still checks out. He is very strong-willed and determined to do or not do exactly what he wants. When he was 16 months old, he had a seizure. It was very long, very scary, terrifying. We waited for 12 minutes before the ambulance got to us, and the seizure lasted for 22 minutes total. It only stopped with medication. After time and lots of testing, we learned that this didn't quite fit the criteria for a febrile seizure, and he also did not have signs or symptoms of epilepsy. To this day, we have no idea how or why he had the seizure, and we are on edge every time he gets sick in case he's going to have another one. Even without this, every time he has a fever, we have to watch how high it gets in case it becomes too high and means an emergency room visit. If he has a fever of 102, we have to go to the emergency room to rule out a urinary tract infection, which may affect his kidneys. He can't take most medications that would reduce these fevers, so we have to hope that Tylenol will help. He has additional doctor's appointments that other kids his age don't need. At least once a year, we have to go into the city, and he has appointments all day long. He's upset every time because he has to miss school or camp to attend these appointments, and he misses his friends. This could increase to more frequently at any time that his tests show a need for additional appointments. During these appointments, he needs to have his blood work to check his kidney function. I'm sure you can imagine how fun it is to explain to the toddler why they have to let the nice person stick the needle in their arm. He also has to have an ultrasound to check his abdomen and kidneys. Our nephrologist takes his blood pressure and collects a urine sample to conduct a urinalysis. This has become much easier once he was potty trained and could aim into a collection cup. The blood pressure has always been tricky for us. The squeezing hurts and then he gets upset, and we can't get a good reading when he gets upset, so we have to start over again, and then he gets upset again. Previously, he also had VCUGs conducted yearly. It was discovered when he was an infant that he had reflux in both of his kidneys. This was not thought to be related to the ARPKD, and it was possible that he would need surgery down the road to correct it. He had moderate in both kidneys, and now it is considered moderate in one and mild in the other. So at this time, they took surgery off the plans. We don't know if this will become necessary in the future or if things will change. He doesn't have any obvious symptoms when you look at him. You can't tell that he has to be more careful than his peers. You would never know that his kidneys are full of cysts and growing faster than they should if you didn't look on an ultrasound. You would never know that he can't take certain medications that others take for granted. You would never know that one day he will need to undergo complex surgery to get a transplant and remain on medication for the rest of his life. Every doctor appointment that we go to could be the one where his blood pressure requires medication. Every ultrasound could be the one that shows his ARPKD symptoms have progressed and we have new concerns. Every round of blood work could be the one that shows kidney function is declining, and we need to start talking about dialysis or transplant. We have no idea what the future will hold or what we should be preparing for, and we have no idea if we're going to have an option that will help him when we need one.
Wow, thank you so much, Julie, and to all of our panelists truly for being so brave to share first today and get us started in this discussion of what it is to live with ARPKD. We now come to our first opportunity as part of today's agenda to broaden the discussion to all of you in the audience. people living with ARPKD, parents, other family members, and caregivers of those living with ARPKD. We want to hear from you about what it is to live with this condition. To get us started thinking about this and to get a sense of the experiences in the audience today, we're going to start with a pair of polling questions. So if you kept up that polling webpage, just go back there now. If you have not had a chance to join yet, you can do so by going to www.pollev.com/ARPKD. Again, that's POLLEV.com/ARPKD. Again, you can keep this web page up throughout the entire day. We'll periodically be going to polling questions, and you'll be able to answer those from that page. So our first polling question as part of this session is we want to know which of the following ARPKD-related health concerns have you or your loved one ever had? And so here you can select all that apply. The options are A, fatigue, B, puffiness or swelling known as edema, C, high blood pressure, D, GI issues, things like nausea, vomiting, diarrhea, and or poor appetite, E, urinary tract infections, F, enlarged spleen, G, shortness of breath or other breathing problems, H, growth failure or small stature, I, kidney failure, J, liver problems, K, anxiety and or depression, or L, some other ARPKD-related health concern that you or your loved one have ever had that isn't otherwise listed here on this as a response option. I do want to point out this is our first question where our audience can select more than one response option. So when we see the percentages here, we're seeing a percentage of total responses. That's not the percentage of people who have picked a particular response. So the best way I like to think of this is the further those green bars go to the right, the larger proportion of people have selected that. So it's a bit of a relative ranking. What it looks like so far is that the most common health concerns experienced by our audience today are high blood pressure, followed by fatigue and GI issues, as well as the enlarged spleen and even growth failure and small stature. After that, we're still seeing quite a bit of experience with a number of other things. We really want to hear from you. What else have we not listed that you or your loved one have experienced? But we see good representation across every single one of these things, which speaks to me in understanding that people living with ARPKD have a high number of different symptoms and health effects that they're dealing with. So we can move to our next polling question. So you'll notice here a familiar set of polling response options, but instead we want you to select the top 3 of these that are most troublesome. So the top 3 most troublesome ARPKD-related health concerns that you or your loved one have ever had, and you can select up to 3. Again, the options are A, fatigue, B, edema, C, high blood pressure, D, GI issues, E, UTI, F, enlarged spleen, G, shortness of breath or other breathing problems, H, growth failure and small stature, I, kidney failure, J, liver problems, K, anxiety and depression, or L, some other ARPKD-related health concern that is one of the top 3 most troublesome to you or your loved one. So we'll give you a few more moments. I'm sure it's hard to just narrow this down to those top 3 most troublesome, but again, I want you to think about the why. Why are you picking this as one of your top 3, whether that's for you or your loved one? And then we want to encourage you to share that why as part of our live discussion that will follow. So it looks like the number 1 top 3 concern is high blood pressure as well as kidney failure. Right after that, we see liver problems, GI issues, and fatigue. I'd say maybe there's a little bit of a drop off, but we see anxiety and depression rated fairly highly by our audience. Other things and enlarged spleen. But except for edema, every single thing here is selected as a top 3 issue for at least some number of people. So I think that's really important for us to understand that while some of these may kind of be rising to the top as more common, most troublesome symptoms, for some people, even the less highly rated ones are their top 3. And it's really important that we consider that broad range of experiences. So now I'd like to thank you. We'll come back to some polling a little later in the program. But if you'd like to share some of your experiences, which of these were in your top 3 and why, I'd encourage you to call in. You can dial in now and at any point during the program by just calling 1-703-844-3231. And that phone number is 1-703-844-3231. It's just like calling into like a radio program or something like that. You'll call in, you'll be connected to somebody who can get you into the queue for us to bring into the live program. In addition to calling in, well, we'd love to hear your voices. Another option is under the live stream on the webpage today, there is a written comment form. And so you can help answer any of these questions and submit written comments. And we'll be reading some of those out throughout the program. No, even if we don't get to your comment today, we will have your comment and we'll be able to include it in the Voice of the Patient report. So while some of you, I hope, are calling in and writing in as we speak, I'd like to also welcome our Zoom panel. These are individuals from this community who will be sharing with us some of their experiences throughout the discussion. And so I'd like to, maybe start with Amy. As you were thinking about, there's such a range of different symptoms and health effects. What stood out to you as maybe the top one or a couple most troublesome of those?
Yeah, hi, I'm Amy. I'm here in Central Ohio. My 11-year-old daughter is affected with ARPKD. For us, we have a lot more liver involvement. So my answers are going to be more spleen, enlarged spleen, decreased activity, worry of variceal bleed that's always in the back of our head. So it really limits what we can do and where she's allowed to go. So for us, our symptoms are more in the liver than the kidneys, but not to say that she doesn't get kidney pain every now and then. So pain in the kidneys and liver involvement for us.
Yeah. So you mentioned that she has more liver involvement, maybe relative to kidney or other things. Is that also the area that kind of results in the most day-to-day symptoms that in terms of how she actually feels, or is it just medically it's the most severely impacted thing?
Yeah, both.
Both.
She has GI issues fairly often, which actually in turn then affect her labs and then affect medications she may have to take. So it's definitely both.
Sure. And in terms of maybe those GI issues or other things that she does feel day to day as a result of the liver involvement, is that something that is truly a daily experience and occurrence for her, or is this something that just pops up every once in a while? Can you maybe describe maybe the frequency of those symptoms and or how maybe the different severity that might differ from one day to the next?
Yeah, definitely. It's definitely, I would say, weekly, maybe not every single day. We do have good days, but definitely weekly. And then there are times where you have to say, okay, is this just a kid that has a stomach ache, or is this something more serious that I need to be on the phone with my specialist about? So it's never normal and it's never easy. And every day, if there is an issue, we both, now that she's 11, she can be proactive in her health with me, decide, is this a stomach bug or is this normal? Do we need to call your doctor? So I would say her symptoms and her difficulties and her pain is not daily, but it's definitely weekly and constantly that we are dealing with her symptoms.
Yeah, and just one last question to kind of help me understand this a little more. You mentioned that you're kind of troubleshooting with her in real time. Is this a stomach bug? Is this something else? Is that at all because they're, the GI symptoms manifest a little differently even when they are liver related? I know we grouped a whole bunch of things together, whether that's vomiting or diarrhea or pain or something else. What's that look like for her?
Yeah, and also does her abdomen look any different today? Is it look any bigger? Is there anything there that's not quite right? And as she's gotten older, her abdomen has definitely been more proportional to her body, which is good for a preteen who's starting to care what she wears. But yeah, we have to just take a step back and and consider if it's the liver involvement or not. And I will say, when those symptoms come, we've had certain instances where we wait, and then we call our specialist, and it's okay, now we're in trouble, because the disease does affect the labs and the fluids. So when a kiddo with ARPKD just has a normal stomach bug, it could be escalated because they cannot compensate as well, and their bodies cannot handle it as well. So we've had various times in the ER with really bad looking labs from a stomach bug that a healthy kiddo would just be over and back to school with.
Oh, wow. Yeah, that really is complex. Not only, just the day-to-day GI, but then when there is something, like a stomach bug causing it, there's that interplay with, whether that's, controlling, edema or other, aspects. So thank you so much, Amy. Lindsay, I'd like to bring you into this conversation, thinking again, such a wide range of different symptoms and health effects. Is there anything that, as you were looking, particularly like the second polling question, that really was like, oh yeah, this is definitely the most troublesome or most bothersome of those things?
Hi, my name is Lindsay. I'm in Arkansas, and it's my 6-year-old son who is affected by ARPKD. We've been fortunate that the disease hasn't progressed to the point that he's terribly affected, but he's always had the high blood pressure, and he used to be terrified to go to the doctor, even to get his blood pressure taken. It was very traumatic, all the medical things he had to go through very early on. He also has the issues with being very petite. He was an average size when he was first born. In fact, in the NICU, they commented, oh, he's a big baby, because all that we see are little teeny weeny tiny ones. Right. So him being normal size looked big to them. But he just has grown so slowly. And he's in school, he's in the 1st grade. He came up to a little girl very recently. Kids really want to interact. Yeah. And he randomly said, hi, do you know how old I am? You know how kids are. And she goes, you're 4. And he said, no, I'm 6. And she said, oh, I'm 6 too. And she stood up and they hugged each other, this, little stranger. And she was so much bigger than him. And I see him all the time. To me, this is what normal is for a 6-year-old, but it's not. The difference is amazing.
Sure. Yeah, and it might be too early, but have you noticed that has impacted, his ability to, keep up at like recess with anyone? I mean, it sounds like maybe obviously he's aware of it, which is why he's asking that question of the little girl in the classroom. So is he noticing it not just because he looks different, but because it's harder for him to do things, or keep up because of his short stature?
I don't think that he notices quite so much. His brother teases him for it, because that's what brothers do, unfortunately. He doesn't really like to play with other kids on the playground, strangely enough, even though he's incredibly active. He has ADHD, and you can't keep him still, and he will climb the highest thing and do everything. So I don't think he realizes that it's something that could hold him back. So that's its own double-edged sword, especially whenever I'm worried about injury or things like that. And I'm worried about him, his heart, because they keep having to check his heart because of his blood pressure.
Right. Yeah, and maybe going to the high blood pressure, we saw that was, maybe the #1 thing rated as a top 3 most troublesome symptom by the whole live audience today. Can you just tell us a little bit about his history with that? Has he always had high blood pressure? Obviously you talked about how that, needing to monitor that has been a little traumatic for him in terms of all of the doctor's appointments, but maybe outside of doctor's appointments in daily life, where does that fit into the different things you have to worry about?
He's had high blood pressure since he was born. So he's been on a high blood pressure medicine since he was about 4 months old, and they've had to titrate it up. And his blood pressures are always high. When we would go to his primary care doctor, they wouldn't check his blood pressure because no one checks the blood pressure of a 2-year-old or a 3-year-old. And I would have to tell them, hey, you need to check his blood pressure, but they wouldn't have cuffs his size. So he could only get his blood pressure taken at the hospital. And his nephrologist said, don't worry about checking his blood pressure at home because different things he does, he's so active, it will read high and it will scare you. Let us just monitor it.
Okay.
But they would always be high blood pressures and they'd have to take his blood pressure, 2 or 3 times until they're like, okay, well, this is just the number that we're going to get.
Right.
Luckily, he likes his blood pressure medicine. It's lisinopril, and he's been taking that the whole time. But sometimes, dealing with things like insurance and getting referrals, there have been times that getting it has been hard, and that's terrifying for me.
Sure.
When I have to be like, oh, I'm out of medicine, I can't get any more, no one's giving me more,
Right.
I have to wait until this appointment or this, referral to come in, or maybe the pharmacy's out and I have to wait for them to get it.
Yeah.
And it causes some stress
Yes,
there.
for sure. Well, Lindsay, thank you so much. Just kind of working through our panel here, Joe, I'm interested to bring you into this discussion of things that are most troublesome or burdensome amongst the various symptoms and health effects experienced with ARPKD. What really stood out to you?
So, hi, I'm Joe. My daughter is 6 years old, and we just found out about We learned about ARPKD only about 2 years ago when she was 4. We went in for a standard checkup, and the doctor saw her blood pressure and said, something's not right here. And we kind of followed it until we learned about her kidneys and what was going on. And it was kind of we had never experienced or heard of anything like that. And for us, in our experience, I think there's the things that we see, which is her being a happy, playful young child, maybe a little bit small. And then there's the things that we don't see. And the things that we don't see are the things that scare us the most. And the only reference that we have to that really is her blood pressure. That's that reminder, because sometimes we could almost even forget. And then we check that blood pressure and we were reminded not just of her blood pressure, but all of the things and the steps that lay in front of us. And so I think, to answer your question very directly, the unknown is what is scariest to us. What are the things that are kind of coming that we just can't predict?
Yeah, no, I mean, that's a really important point that you're making, that unknown or that uncertainty about what to expect, knowing that the disease really is there, and that blood pressure being maybe the, numeric readout that reminds you of that. What are those things, as you're thinking and when you see the high blood pressure reading that you're thinking about what it, you mentioned, there's a whole range of things that might come in the future for her. Is there something that's kind of, the next thing that you're most worried about?
Yeah, I think that's a really good question, because we're just barely coming to terms with the fact that she has challenges with her kidneys. And I've tried to, for the most part, avoid the liver. I can't even comprehend that now, because we're still adjusting to understanding what it means for kidneys. And I think at our stage, we're really dealing with the psychological effects that are kind of come along with that we don't really think about a lot, where she's growing and she's experiencing these things and she can't do certain things and she can't eat certain things. And she might say something like, it's not fair that I don't get to do this because I have kidney disease. And those are like phrases and things that kind of reflect a sort of deeper level of reflection that as she gets older will only become more and more difficult to comprehend and to work with and to work through. So I think the next step for us is really understanding how to give her the best sort of support socially, psychologically, and then also kind of prepare her for, like I was saying before, the unknown, all of these things that could come, that they're not surprises to her, that she's ready and able to deal with them.
Yeah. And you know, that's you know, great and really great that you're you know, thinking so proactively about providing her that support. You know, how aware is she, you know, of what's really happening in her own body today? You know, is this really, you know, you're more thinking about, you know, may become more obvious to her if things start, you know, popping up and becoming more severe in the future?
Yeah, so I think she's really aware of what's going on. We've kind of, through the community, have come up with great kind of recommendations and ways to express that in a way as she's young and she gets older. But I think right now she's really starting to understand it more and more deeply, because it means one thing to know that, oh, I have ARPKD, and it's another thing to understand what the outcomes of that are and what the challenges of that are. And as she gets older, right now, 6, 7, I think as she starts to get into like 10 years old, that really becomes an age of reflection and deep little adults running around, right? And that's kind of the difficult. And by that point, she will even be further along within the progression of the disease. So, yeah.
Well, thank you so much, Joe, for sharing all of that. I do see that we have a number of written comments that are coming in. Before we go and check in on some of those, I do want to, you know, see if anyone in our audience would like to call in and join the conversation. Again, you can call in by dialing 1-703-844-3231. You know, just as you've heard us discussing with some of our your peers that are on Zoom, you know, we'd love to hear from you as well. You know, some of the things that about living with ARPKD, the impacts that they've had on you or your loved ones' lives. So again, 1-703-844-3231. But Susan, I know you're you know, looking at all of these comments that are coming in. What are we seeing in terms of impacts of the direct impacts of ARPKD?
Yeah, great. So Katie in Austin shares, as it is, it's hard to make long-term plans, and my grandson will soon be a teenager looking at job and education options, social relationships, etc. She goes on to share that right now my grandson is looking at dialysis and or a transplant at some point, but they have no idea when. Also, Allie in Alabama shares, knowing what our son's kidneys were doing and would eventually do to his little body was extremely hard to comprehend. His systems would become better with time. He has grown into his kidneys. But I still have moments wondering whether he'll be able to live a fulfilled life like other children. She continues, we've gone on through over a year of feeding therapy to get our son to eat by mouth today. But the worry is still there, that the physical limitation of enlarged kidneys keep him from eating enough.
Yeah. Well, thank you so much for those of you who have been writing in. We'll continue to read out some of your responses throughout the program. I'd like to come back to our Zoom panel here and Shauna, bring you into this discussion. You know, again, we're still, you know, focused on, you know, there was such a wide range of different symptoms and health effects. You know, what are the top one or a couple of those that are most troublesome in your experience?
Hi, I'm Shauna. I'm from West Virginia. Just a little background. I was diagnosed with ARPKD at the age of 4. So I've had about 20 years with the illness. And for me personally, my biggest issue has been with my liver, and I had an enlarged spleen. But at the age of 13, I had a splenectomy. So that's kind of resolved the issues with the enlarged spleen. But I still, you know, have the liver complications. Still have high blood pressure, but it's very controlled.
Yeah.
For me, a big thing right now is fatigue. I've noticed I've had, you know, low vitamin D levels or low iron levels, and I'm not saying it's attributed to the ARPKD, but you know, it's just something that I've had hand in hand. So right now, that's a big issue that I'm facing. And in recent years, I've had a couple blood clots, so just managing that, doing my scans and checking to make sure everything's okay is kind of what's going on for me right now.
Sure. Well, thank you for participating in today's meeting and speaking as someone living with the condition. So you said right now it's the liver issues. Would you have said 10 years ago that it was also the liver issues, or is that the liver involvement been kind of pretty consistently for you? The top issue that you've been experiencing.
For me, I've always had a heavier involvement with my liver. My kidneys have actually been pretty stable,
Okay.
minus the high blood pressure and the medications to control that. So I've always had more of an issue with my liver on that side. And right now I'm not at a place where I'm ready for transplant, but I have the high blood pressure, like I said, the portal hypertension. I've had esophageal varices. A lot of that was resolved with the splenectomy, and just I had like a devascularization, so a lot of that was rerouted. So I would just say it's mainly been liver for me.
Right. And if you think about day-to-day life, knowing now that I understand a little bit about what is kind of most involved for you, are there things that when you wake up in the morning, you're going to be having a good day or a bad day? Either you mentioned fatigue being a big issue that you're dealing with, but even other symptoms. Can you tell us a little bit about that?
Luckily for me right now, most days are pretty good days. I feel like I always have a level of fatigue. It's something I've just gotten kind of used to and just manage, on my own. It's just making sure I get a good night's rest and try to stay hydrated. So I feel like that's the ways that I try to battle that. There's definitely days I wake up and I know I'm just going to be tired all day long, and I can just tell with my energy levels. And I just, days I am tired, I just try to rest, do as much, do as little as possible. And the days I have energy, I take advantage. So.
Yeah, can you maybe give us an example to understand, what's something that you can do on a good day that you wouldn't be able to do on one of those days where you need to rest more?
So I have been working out more. I try to be consistent at least 3 times a week. I do Orange Theory, actually. But there's some days that, I'll get close to it. I'm like, you know what? I just know that no matter what I do, no matter how much water I've drank, like I can just tell that my body is just not ready for that today. So I just, maybe walk instead, or, just relax a little and just let my body rest. Just listening to what's going on.
Yeah. And how many weeks in a month do you have to skip one of your Orange Theory, your sessions, or kind of equivalent activities, would you say?
It really depends, because I only go a couple times a week, so I try to just make sure it's days that I am feeling good. So I would say I maybe skip 2 a month, maybe 3.
Okay. Yeah, no, that's really helpful. Thank you so much for sharing that. And Michelle, to kind of come to a full circle here with our Zoom panel, again, same topic, same question, which symptoms and health effects are most troublesome?
Hi, I'm Michelle. I live in New York. I have 3 sons, and 2 of my sons have ARPKD. So for us, it's a little bit different with navigating having 2 children with the disease. They are now 23 and 17, and we did not find out about our older son until we had our 17-year-old. So when he was born, he was diagnosed, and we had these 2 older children that appeared healthy. And we did ultrasounds anyway because we were nervous, and he was 6 at the time, was diagnosed. So he definitely started out much milder, didn't start with high blood pressure until he was 7. So for us, our day-to-day is more just looking at the differences between the 2 of them. So that would be a big one with us. They both appear to be a little bit more on the milder side, but are presenting slightly different. They both have very mild livers, thank God. And our oldest didn't have any decline in kidney function until he was 16 years old.
Okay.
But now we've seen a bigger decline. So from 16 to 23, he's gone down a fair amount. He's hovering around 60% now. So I would say that navigating the 2 of them and the different medications and the different doctors and the different symptoms, is one of our biggest one. And then also they both appeared to catch more of the common cold or more illnesses than their friends, and even more than my middle son. So for us, the doctors were like, oh no, it's not related because they have such good kidney function, but we really do think it is, since our middle son is pretty much always healthy, never has the cold. And then when they get colds, they tend to keep them for much longer than other children.
Oh, wow.
So I would say that's our big one. And then now navigating going into adult care and figuring out transition and mom being a little bit less involved, and how we can figure that out with making us all happy with the doctor's appointments and knowing what medications they need to be on and advocating for themselves.
Sure. So it's definitely a very interesting to hear you describe, both kind of commonalities, like they both are more prone to, catching colds and other illnesses. But you also alluded to the fact that they do have differences. Can you maybe give us an example of maybe today, or it could be in the past, of what, those differences and what they're experiencing really looks like?
The two big differences are that our youngest has a slightly more liver involvement, so he has bile backup in his gallbladder and takes a medication for that, whereas my older son has never had anything related to his liver.
Okay.
And then the other one is that our younger son had major growth problems and needed to be on growth hormone. He was tiny from the beginning and then fell off the charts when he was 4, and we finally started growth hormone at the age of 7. But ironically, he's now the tallest of our 3 boys, so the growth hormone worked.
Okay.
Which was amazing, and he loves it and he's very proud of that. But I would say that those are the 2 biggest differences between the 2 of them.
Yeah, and pleased to hear about some of the treatment kind of successes that both of your boys have had. I guess the only other real question that I have is, given some of those differences in what they've each experienced, what has that translated to for them in terms of, their, whether it's, it's hard to exactly frame this, like self-identity or any kind of worries and fears that they have that might, make them more anxious or even, depressed?
My younger son definitely has had a lot of anxiety surrounding the disease, especially when he was younger. When he was about 8 or 9, he had a lot of panic attacks.
Wow.
And we really think it's because of the disease, because at the time he was having a lot of appointments, he was having a lot of issues. And also I am involved with the PKD Foundation, and I was talking about it a lot more at home. So it was kind of in our day-to-day. So he had a lot of anxiety. And then over the years, he's had therapy, which has really helped. And our oldest has had a little more anxiety, but more as an older child going into adulthood. And I think more related to trying to figure out how he can do college and the alcohol and the friends and who he's going to tell and taking his medications. So a little bit different for him, but related to the kidney disease.
Sure.
And then also having a middle child who's healthy in the mix of all of that. So
right.
It's a lot.
It is. Well, thank you for being willing to share that aspect of it too. It's really important. I do want to broaden the discussion a little bit, but before that, I want to check in and see, what are we seeing in terms of symptom and health effect comments from our audience?
Thank you, James. So Stephen shares, my child was diagnosed with enlarged echogenic kidneys, no amniotic fluid, an enlarged liver and spleen, and experienced issues with lung development, failure to thrive, dialysis, adrenal insufficiency, seizures, high blood pressure, pulmonary hypertension, feeding issues, and gross motor delays. Also, Allie in Alabama. In our son's first year of life, the hardest symptom was enlarged kidneys that limited our son to eat by mouth. This caused endless vomiting, lack of weight gain, and constant worry. She continues, I had a really difficult time when my son was a small baby looking at the size of his stomach. To this day, I avoid putting him in pants because I know they will just fall off.
Wow. We'll continue to keep the comments coming. We want to hear those, and we'll continue to read those out throughout the program. today as well. So this has already started to come up a little bit, but we've mostly been focusing on the direct symptoms and health effects. But we know that the constellation of things that people are dealing with living with ARPKD, have impacts then on activities in daily life and other aspects of quality of life. So if at this point I want to invite you to go back to your polling webpage, go to that browser that you had open, whether that was on your computer or on your cell phone, or if you have just joined us, if you're someone living with ARPKD or a parent or other family member, we encourage you to join us at pollev.com/ARPKD. Again, that's pollev.com/ARPKD. Here we have a question that is focused on those impacts in daily life. So here we want to know, what specific activities are you or your loved one either not able to do at all or struggle with due to ARPKD? And here we want you to select the top 3 activities that are limited as a result of the condition. Options here include A, personal care or household chores, B, attending school, C, socializing with friends, D, walking, E, biking or playing sports, F, sleeping, G, working or having a career, H, relationships with family and friends, or I, some other specific activity that you or your loved one with ARPKD is not able either to do at all or struggles with as a result of the condition. And as you're thinking about this, I want you to think about which symptoms or health effects maybe are contributing to you or your loved one not being able to participate in these activities, or is it hard to tell? There's so many different things that you're living with, we want to hear, also your kind of how these impacts on activities of daily life have changed over time, just so much like we've heard about the changes in symptoms and health effects too. So as it stands, it looks like, perhaps the top 3 activity that's limited is biking or playing sports. After that, we see a drop-off, but maybe the next cluster is attending school, socializing with friends, sleeping, as well as other things that aren't listed in any of our other response options. But we do see all things here, including relationships, working, walking, and personal care and household chores as being in some number of people's top 3 things that are most impacted as a result of ARPKD. So a wide range of different impacts on daily life, as a result of this condition. So if you'd like to share some of the impacts on daily life that you've been going through, you can call in. That phone number is 1-703-844-3231. Again, that's 1-703-844-3231. We do also have that comment box that is on the web page that you're following along with today, so you can also continue to submit written comments as well. But I'd like to go back to our Zoom panel now to get us started on this kind of topic, knowing again that we've already started to address this a little bit, but maybe now that we're addressing it directly, I want to see what maybe stands out the most. So maybe, Lindsay, we can start with you this time. Again, looking at the wide range of activities, some of those maybe we'd even call quality of life issues. What are the things that are most impacted in your family?
One thing that I can say is, thankfully, with the level that his kidneys are at right now, he's not restricted from much. And he's sick, so there's only so much he can do.
Yeah.
But he has this adventuresome spirit, and he's constantly saying stuff like, I want to go hang gliding. I want to hang glide when I grow up. I want to do this when I grow up. All these things that I have to say, you probably are not going to be able to hang glide when you grow up. And you probably are not going to be able to play football and things like that and go rock climbing, because you do have these large organs that are going to be more sensitive to injury as you get older. Or if he has the transplant where, you've got to protect those at all costs. So currently, these things are not really restricted, but I am concerned about the future and all the things that he wants to do that he's probably not going to be able to do.
Yeah. So as of now, no restrictions for him, in terms of recreation, playing, in the backyard or on the playground, that kind of thing.
Yeah, I don't like it when he hangs upside down because I read that increases blood pressure, and blood pressure is such an issue.
Right.
So but you can't hardly keep him still. So.
Sure. And how does that make him feel when you talk about the future and, the fact that, well, today, these kind of, pretty adventurous things that he wants to do may not be realistic for him, for the reasons you described?
He gets upset, and he'll shout out, "That's not fair," that kind of thing. But I think in general, he handles it pretty well. The being frustrated doesn't usually last very long because then he's off to do his next thing and fantasize about his next future endeavor.
Sure. Yeah. Well, thank you for sharing that, Lindsay. Michelle, maybe we can come to you on this topic. Any activities in life, aspects of quality of life, like social and family relationships, that you would describe as being most either difficult or maybe even impossible to do because of ARPKD.
I would say social things over the years. Nothing impossible, but my youngest definitely had more of a problem at night with needing to wear pull-ups and not being able to hold his urine overnight until a much later age than all of his peers. So for him, socially, he never did sleepovers. He would have friends come here sometimes because he could control it a little bit more. Fourth grade, they went on this big trip that all the fourth graders did, and he wouldn't go. So I think that would be a big thing. And when they got into their teen years, not really wanting to talk about it a lot at school. So the fact that they needed water more than their friends or needed the bathroom or the nurse was a little bit hard for them to figure out, and not wanting to talk to their friends about it as much and not wanting it to be as known and such a big part of their life. So I would say the social aspect, and then, like I said before, for my older son going into college and trying to figure it out.
Right. Are there similar examples? You talked about at a younger age, not going to the sleepovers, those types of activities, but as maybe it becomes a little bit more complex, as they're older and they're navigating more complex social, friendships and relationships, do you think that there's anything in their life that they kind of withdraw from or are a little bit more hesitant to participate in, as a result of those, kind of things, either that they don't want people to know about or maybe they're worried about, from a health perspective themselves?
I know for my older son, just dating in general, and he had a long-term girlfriend from high school, so it was a little bit different because she knew him for so long. But now he's not dating her, so finding new people to date and having to explain to them and thinking about the long-term situation of, I'm going to need a transplant and these are my medications I have to take and the long-term thing. And I think that causes him some anxiety as far as, and also work environment. He just started a brand new job, his first real job after college, and having to tell them trying to decide what he's going to tell his job and what he's not going to tell his job.
Right. Yeah, and just for context, like what obviously he's worried about what he will and won't have to tell them, or what kind of he'll need to do to, be able to participate in the job. What kind of job is this? Just so we have a sense of what he's navigating.
He's a civil engineer, so he is working at a construction site.
Yeah. Yeah, that certainly, as someone whose brother is a civil engineer, I know that, you think of them sitting behind a desk doing drawings, but no, in reality, they're out wearing hard hats in the heat and all the elements. So, yeah, absolutely. Shauna, I'd like to bring you into this discussion as you think about, the things in your life whether today or over the years. What has been hard for you to do or maybe impossible?
I would echo Michelle on a lot of the things growing up. I mean, I feel like we had a similar experience in that sense. But it was something I didn't really tell a lot of people unless I was like close to them. I think it's just your level of comfortability with it. But I had a lot of great friends, a great support system. So I feel like I didn't miss out too much. As an adult, I feel like with work, it can be a little more difficult just because you have to miss a lot more, maybe schedule your doctor's appointments or try to schedule everything the same day, or, explaining, hey, I'm not just taking the day off, but like for me personally, I travel to Cleveland. So, that's a whole day in of itself of just going to a doctor's appointment, and having to do that at least twice a year or more. So,
Sure, sure. And you mentioned like maybe with closer friends, you were able to share with them, but not others. But outside of that, you didn't need to as much or chose not to. Can you tell us, a little bit about, how you're able to navigate that? Is it, the things that you experienced weren't things that maybe would be readily noticeable to someone who, isn't looking for them, whether that's, the symptoms that you have or the things that you're doing to try to stay healthy and navigate life is kind of in your day-to-day when you're out and about. Would you say that people would or wouldn't be able to know that you have ARPKD?
right now at this point, I feel like just meeting somebody firsthand, they probably wouldn't recognize it or notice. It's something that, in conversation, if we get to talking and it comes up, I'm open about it. I'll talk about it. It's not that. It's just, when you're a kid, it's different. It's hard to explain to other kids what's going on, especially when you're just a kid yourself. But as an adult, most people are very, nice and compassionate and understand where you're coming from. It's just not something that they can see off the bat most of the time.
Right. Wow. Well, thank you so much for sharing that, Shauna. I do see we have a phone caller. We have Lisa from Cleveland, Ohio, that wants to talk about some of the impacts of ARPKD, in terms of what her kids go through socially and with peers. So, Lisa, I'd like to welcome you to the program. Are you with us?
Hi, thank you so much for having me.
Oh, well, thank you for calling in. We'd love to hear a little bit about some of those impacts that you wanted to share.
So I have two daughters with ARPKD, and my oldest is severely affected. She's at about 40-ish%, and she's so exhausted. She's 13 years old, and it's really hard for these kids to try to explain how they feel, especially now that she's a little bit older. Her friends want to go do things and stay up late and hang out, and sometimes she's just too exhausted or she just doesn't feel good. And for them to try to explain to their friends what they feel like, and she's such a sweet kid, and it's hard for her friends to understand how she feels. And we're just starting to notice that they don't necessarily, they'll go do things without her because they're just so used to her being too tired or not feeling well. So even just socially, how this disease affects these kids is very traumatic.
Wow. So you're saying not only are there times where she has to opt out of, certain activities because of how she's feeling, but, that's actually impacting the way that her friend group or her friends, how often maybe they invite her out or do things with her.
Absolutely. And I know that we have a lot of, older ARPKD kids that we've socialized with through Facebook. And that was one thing that a lot of them had told her because, she'll talk with them and meet with them over Facebook when times are hard. And, it happens to a lot of these kids that they're just so tired that, it's hard to keep going and keep up with your friends.
Are there certain things like, certain activities that are, harder for her to do with her friends that otherwise she would want to be doing? Or maybe even does it matter, if this is like, something on a Saturday morning versus, later in the evening on a day? Does that seem to really make a difference for her?
I think it depends on the day. I think it's Shauna was saying, it just depends on how she feels. So we're in Ohio and we live close to Cedar Point, and there's certain rides that my daughter can ride or can't ride. So if she goes to Cedar Point with her friends, even just in a joyful time that she's being included, she could be, not able to participate with something like that. So, and then too, it just depends on the day. She has days where she's absolutely exhausted. I know Michelle had said something about her kids being sicker than normal, and my girls are always sick, but especially the oldest. She actually is sick with COVID right now, and my other two children, the other one with ARPKD, who is younger, she was pretty sick, but got over it a little quicker because her kidney function is much higher. And my son had no symptoms at all. My husband and I seem to be doing just fine. And then my poor oldest daughter is just down for the count. So even with sicknesses, she's just sick a lot. And so think about it too, like all the times that she's sick, she's missing school, and then she's missing all those social interactions and cues from her peers at school as well.
Yeah, wow. It sounds really kind of, like there's, these social impacts are hitting from all angles with this condition. Has this, been pretty, consistent with her over time, or was this not as much, something that she experienced maybe when she was a younger kid?
Not as much. It's definitely getting worse as her kidney function decreases.
Yeah. Wow. Well, Lisa, thank you so much for calling in and sharing, you and your family's experience with this. It was really helpful to hear and understand some of those impacts on social life and really how so many different aspects of ARPKD contribute to that. So thank you so much for sharing. I'd like to come back to our Zoom panel here. Amy, as Lisa was talking, I saw you nodding quite a bit there. So I'd like to loop you into the discussion, in terms of these impacts on activities in daily life.
Yeah, I think I could relate a lot to what Lisa was saying and what everyone has said really. But my daughter and I were actually talking last night because she's 11 and went to a middle school this year. So brand new school, brand new teachers that don't know her limitations. She does have to always have water, free access to the restrooms, and then gym class is an issue. Luckily, as she's gotten older, she knows what she can and can't do. Like they were doing dodgeball and she was like, hey, I should probably opt out of this, especially as other kids have gotten stronger. No contact sports has always been the rules of our doctors. So, and she knew, hey, I'm not supposed to do this. So that's really nice, but it's really stressful in new environments to just hand her over and be like, okay, she can't do this, this, and this, but to not be there to make those decisions is tough. And when she went to kindergarten, that was really hard. She had to sit out the first day of an activity just because the gym teacher wasn't really sure. So it's really made her feel singled out and kind of self-conscious of that because she can't do what everybody else is doing. And she's also had some self-esteem issues about her bigger stomach. She's grown into it a little bit, but as she's hitting that preteen age, I worry a lot about self-esteem and body image for her.
Yeah. And so I just wonder, these limitations has she always been so good at, obviously you can only be there and help, navigate those situations so much as the parent. Have there ever been times where, I mean, at any part of her childhood where, she wasn't, capable or able to opt out of something that maybe was higher risk for her?
Yeah, absolutely. She's done different things, kind of like she did some gymnastics, which I let her do. She's wanted to do various things. She's not a big sports girl, so I have gotten lucky there. I haven't had to say no a lot, but she wanted to like do horseback riding or do other things, but she had asked her liver doctor directly and the liver doctor told her no. So I've gotten my fair share of it's not fair and everyone else can, or they're going to a, trampoline park and, and all that stuff. So there's definitely been things that she has not been able to do and has had to opt out. But when she does do, a trampoline park or something, she's been safer about it. So there is hope as they get older and they start to learn what their bodies can and can't do for their own safety.
Wow. Yeah. Thank you so much for sharing that. And Joe, I want to give you, the final word here from our Zoom panel on this topic of impacts in daily life. Is there anything that, stands out to you at this point in where your family's journey is that you're currently limiting or thinking about in terms of what you may or may not be able to do?
Yeah, it's something we think about a lot, and I think, well, there's all the things from on the one spectrum of like not being able to do things, and then there's the other things, the extra things that she does, like bring a massive thermos to school every day that's bigger than she is almost, and she has to drink through the whole thing throughout the day, and every day when she gets back we check it, and it's a celebration when she drinks it, and all of these things. And so and those are things that other kids notice as well and ask her about. And so it's not just about whether or not certain symptoms are seen, but there's all these extra things that kind of revolve around her and kind of kind of float around and make these things more obvious both to her and the people around her. And so I think for me, the challenges that we engage with are like wanting her to feel happy and not feel restricted, but also preparing her for when some of those restrictions come, that she does it from her own accord, that she can manage those things, and that she's not waiting for someone or a teacher to say, hey, did you drink your water? So I think for us, some of the biggest challenges of like trying to find the way to help her guide herself through this.
Wow. Well, thank you so much for sharing that, Joe. I do see that we have some written comments that are coming in talking about impacts on daily life. Susan, what are we seeing?
Yeah, thank you. So Jennifer in South Dakota shares, my son, who is almost 20, never had limitations because luckily he never had interest in contact sports. He was a runner, so he participated in track and cross country. When he was 17, the doctor started him on a medication to help with portal hypertension, but nobody told him that this would affect him being able to push himself when running. His times got worse. It really affected him mentally until we finally asked the doctor, who confirmed that that was a problem. So some of what we've heard through some of the other comments as well. And then also, Colin adds, my child had underdeveloped lungs, so it seemed he caught every respiratory bug out there. We just need to watch hydration very carefully, as dehydration definitely affects him more. And finally, Logan says, we'd like our 10-year-old to have the energy, so he shouldn't miss out on other activities.
Yeah. Well, thank you for everyone who's been writing in. We're going to do broaden the discussion one more time here this morning. As I forecasted a little bit earlier, while we did want to spend such a good amount of time exploring what you all have already been living with, we also want to explore a little bit about what you're thinking about for the future. And I think again, these things are also interrelated. We've heard a little bit already about some worries for the future. But here we're going to go to a polling question to bring our audience into the discussion. So if you can go ahead and go to that web browser on your computer or on your phone, go to www.pollev.com/ARPKD. Again, that's POLLEV.com/ARPKD. Here we want to know what worries you the most about you or your loved one's condition in the future. And we'd like you to pick the top 3 of these different worries. The options are A, needing dialysis, B, needing kidney transplant, C, that my symptoms will get worse, D, injury to the kidney or spleen, E, needing to quit schooling or work, F, worsening impaired thinking or memory, G, needing extended care, H, dying prematurely, or I, some other worry that you have for yourself living with ARPKD, or you have for your loved one who's living with the condition in the future that represents one of those top 3 greatest worries. I told you that these questions would get harder to answer and as the day goes on. So I know that this will be a hard one to make the selections for, but as always, I want you to think about, what's going into your thinking as you pick some of these. Are these things that you're worried about in the near term, or are these more longer term worries? What is informing, your worries that you have, and are these things that you really think about day to day, or And if so, how does that weigh on you, and how do you cope then with those worries? So while final results are trickling in here, it looks like the top worry is dying prematurely, followed by needing a kidney transplant and needing dialysis. After that, we see worries about needing to quit school or work as a kind of in the middle here as a top worry for the future. But every single one of these, except maybe for worsening impaired thinking or memory, are in some number of people's top 3 greatest worries for the future. So we want to hear about these worries, what you picked, and a little bit about why you picked those. So if you'd like to share about some of your worries for the future, I'd like to invite you to call in. You can dial in at 1-703-844-3231. Again, that number is 1-703-844-3231. You can also write in with written comments here that we'll be able to share in the program using that comment box under the live stream on your webpage here today. So again, to get us started on this topic, I'd like to come back to our Zoom panel. And maybe this time we'll start with you, Shauna. As you think about your future living with this condition, what are the things you're most worried about?
I think all the things listed are, obviously worries that we all have in some capacity. The biggest thing for me is just work and school and, just my symptoms getting worse. And, obviously dying prematurely is also very nerve-wracking. I am older, but thankfully I've, had a pretty mild progression. So, those are all worries that we all have. You just got to take it day by day and see where it goes.
Sure. In terms of, the first thing you mentioned was worrying about, schooling and work, being able to work. Are there certain, aspects of your ARPKD that you're worried might worsen and make that harder, whether that's certain health effects or symptoms?
So right now I have a few nodules on my liver that they're watching, so those could develop into something in the future. It could cause for a liver transplant, and I'm not sure how that would work, with work and just, recovery and going through that whole process. So it's definitely something that I'm looking out for in the future. So.
Yeah, absolutely. Well, Shauna, thank you for being so willing to share that. Joe, I want to bring you in on this question. What is it as you think about whether it was the range of options we gave or something else beyond that? What represents your greatest worries?
Yeah. So when we first found out a couple of years ago, and I turned to the internet to find out what was going on, I felt like we were on borrowed time. Like the fact that we had gotten to 4 was a miracle in and of itself. And so I had this weird thing where I went from feeling like she was the most healthy child in the world to feeling like I was on borrowed time. And I think my mindset sort of shifted to going, I'm hoping for a long, even if difficult, life. Like we're going to struggle through this together, which is not something you ever think you're going to hope for. But that's kind of where I found myself and where our family found ourselves. And as we start to go along, we start to adjust and we start to deal with the impact and understand what that means. But for me, the thing that I think about the most in the future is just wanting to make sure that she's prepared for it, that she's strong, that she can deal with it. Even if it's hard, it will be hard. And so obviously the premature death is the root of everything.
Yeah.
But everything else kind of is just a part of that journey.
Yeah. And Joe, I think what you said is really profound. It's kind of like all started with this, borrowed time and fear of premature mortality. But you also talked about, the things that you were thinking about and the struggles. Where did, what kind of, quality of life, concerns were you thinking about when you use that term struggle?
Yeah, well, when I was initially looking into it, and I mean, I know that the kidney and the liver are essential organs for the body, and I didn't know what that, and I mean, I didn't even know how painful it's going to be. Like, how painful is it for a kidney to go through this? Is she going to be suffering? Is she going to be crying? Is she going to be in pain? Is she going to be all of these different things? So I think the journey of just learning what this means has been painful in and of itself. But, you know, as we start to grow more and as we start to understand it, I think we become more prepared to deal with these things. But the reality is, I'm talking, and the community is a huge part of like helping this, but like everyone's going through different stages of this. And so I get to see what stage she'll be in at some point.
Right.
And that's scary. And so I get to prepare for it a little bit as some like Amy and others, you know, experience some of these things before I do. Okay, this is what's going to happen, but we don't know when, you know. So it's just there's so much psychological strain and pressure that goes beyond just the physical attributes that we worry about.
Absolutely. Thank you for sharing that, Joe. Amy, you know, would like to get your thoughts on this topic of, you know, the greatest worries, and, you know, any thoughts that you have about how you and your family cope with those worries.
Yeah, so I can definitely relate to what Joe was saying. When my daughter was diagnosed, she was 6 months old, and I felt the same way. I just thought, oh my gosh, I don't get to keep her, my poor baby, without really understanding the disease. And over time, thankfully, I've gotten to keep her. But there's always that little voice in the back of your head that's like, but for how long? You know, the dying prematurely thing is very, very scary. And I have two different sets of worries. I have short-term worries of, is this lab draw going to show more declining function? Is this scope going to show worsening esophageal varices? Are we going to be heading for shunt surgery in the future? And then I have long-term worries. Is she going to get to, you know, as Michelle was talking about, go to college and have those experiences and grow up and get married and have babies? So there's two big sets of worries, and I hope and I know, and it's so refreshing to see Shauna here, that she'll get to do it all, and no matter how hard it is, we'll do it together. But yeah, they're two very real always in my mind sets of worries for us.
Well, thank you for helping us understand that, Amy. I do see we have a phone caller. We have Lindsay from Virginia, who was actually one of our earlier panelists that we heard from, but wants to add to this discussion of worries for the future. So, Lindsay, I'd like to welcome you to the program. Are you with us?
Hi, yes, I'm here. Thanks so much.
Hi, welcome. Would love to hear what you'd like to add to this important topic.
Yeah, I just wanted to add, as a parent of a child who was on dialysis and had a transplant 10 years ago and is now in middle school, the worry about, because we've been through it, we know the traumatic kind of events that occur during dialysis and transplant, and is it going to work? Is it not going to work? Are expectations going to be met? I think about the next time this is going to come, because it will come. That we know. You know, the average transplant lasts 10 to 15 years, and we are now in that zone. So, you know, try not to worry each time we do labs every 6 weeks. And that's not so difficult, but it's just that fear that exists in the back of your mind every single minute of every single day, and just tamping it down the best you can. But it's going to happen, and we just pray that it's not going to happen maybe during the middle school and high school years, since those socially are the most difficult, I think, for kids, and especially for our kids dealing with medical issues all the time. That maybe it will happen, hopefully, a little later on. But again, we know that it's going to happen, and it's just, when is this going to come? How bad is it going to be? Are we going to find a donor before he hits dialysis? will we even find one? The more donor-specific antibodies they have, the harder it becomes to find a donor. So it is just a constant cycle of worry and concern for your child. And, every parent has worries and concerns for their child, especially about their future. But as us ARPKD parents, ours is just magnified on a much larger scale. And you can't really talk about it with most other normal parents or even family because it's difficult and people can't relate. So it's nice to be able to, see other parents and know that we all have these concerns and issues for our children.
Yeah. Well, I really appreciate you sharing this, Lindsay. I mean, it sounds like the worries that you have about this, the need for a new transplant to come. I mean, there's so many pieces to this, when will it happen? Is that going to be a high impact, point of time in her life in terms of, when she's going to be, out needing, to go through this, procedure and recovery. But also, having gone through it before, I'm hearing you describe, the worry about needing to go back on dialysis and, maybe even the uncertainty of getting another, donor or being eligible, with a narrow, range of maybe, donors that she could accept. So is there anything else that you would want to add in terms of, what is driving this worry for this kind of, future uncertain, but as you described, almost guaranteed at this point, impact?
Yeah, and I think sometimes, the internet is a wonderful place, but it can also be a really scary place. Mm-hmm. So we've all benefited from being able to find each other on the internet and see our children's stories and learn from each other. But it can also be scary because you can see the scary dark side of ARPKD as well. Watching children in our community pass away, waiting for transplants or from other issues. And so that, of course, adds to the worry. And also seeing adults, struggling through this disease as well, frequent hospitalizations and infections and all those things just compound upon itself. And, as a parent, you just want the best for your child and you want them to grow up and live a happy, healthy, successful life and be able to provide for themselves and not rely on someone else. But when you're living in a hospital, in and out of a hospital, that's difficult to do. So, seeing that is hard, but it's also, you can also learn from it and prepare yourself.
Absolutely. Yeah, we hear that, I think, as a theme for coping is, seeing what others have gone through and learning from that and the strength that is in this, community that you all share together. So thank you so much, Lindsay, for calling and sharing that.
Thank you.
So I'd like to come back and check in with our Zoom panel here. Michelle, I don't think we've had a chance to hear from you on what represents maybe the biggest worry or fear for the future.
I think, like Lindsay said, as a parent, we worry anyway. And then to add in the extra stress as a caregiver with children with ARPKD, it's a whole different level. And for me, it's taken me a long time. I had a lot of anxiety surrounding the disease when the boys were younger and first diagnosed, and I had a lot of panic attacks, and I was really only thinking about the future. And so it's taken me a very long time to get here and try not to worry quite as much and just to live in the day-to-day. And like Amy said, it's refreshing to see Shauna here and to see an older young adult with the disease and how they manage. But definitely the worry for me is the long term and what their life is going to be like, their quality of life. And will they be happily married and with children and have a successful career? I just want my children to be happy. That's really all I care about for anything. And it's hard to be completely happy when you have a health problem looming over your head. So I think for me, it's kind of everything just looming there, kind of like a ticking time bomb waiting to go off of when all of these things will happen. And not just necessarily the transplant and dialysis, just all the other little things that happen along the way.
Yeah, I mean, I kind of wanted to see what you thought about that, because obviously there's the end stage kind of, organ impacts, but, it sounded like you might be alluding to some things along the way. Are there certain worries that are nearer term that you worry will impact, quality of life?
I think just the social aspect for them and worrying about what their friends think and their potential partners in life and their job and just being happy. And that I worry that the anxiety for them sometimes takes over, and they're not as happy as they could be because they have to deal with it. I mean, they do, even though they're milder, they still have to deal with it every day because they take medication every day. They have high blood pressure. They have to monitor their blood pressure. They have to think about these specialists and these doctors that they have to make appointments with. And now that my oldest is going to adult care, he has to take more of this on versus me doing all of the appointments for him and getting his medications and monitoring. So it's a lot to think about as a young child, a young adult. I wouldn't want to think about all of that. What medications? Oh my gosh, did I take my medicine today? Did I refill my prescription? Can I have this Can I take Tylenol this many times? Can I have one sip of an alcoholic drink? I mean, it's a lot.
Absolutely. Thank you so much, Michelle. Lindsay, I'd like to also get your thoughts on this topic of what might be represents some of the greatest worries or fears for the future in your family.
Yeah, whenever my son was first diagnosed and they had a specialist come in and told us what they thought it might be before the genetic testing, and is hoping that it wasn't that until the confirmation. And then I thought, I thought the end was like imminent, and it was very terrifying. And over time, with him being okay, now I think more towards the future, but I think besides obviously the premature death, I worry about dialysis. It's difficult on people's bodies. It lowers life expectancy. It's painful, and you hope that the place you're going to is doing all the things they're supposed to be, because even though generally they do, every once in a while you hear those stories where they're not, and it's just, oh my gosh, I'm so afraid for him. I'm afraid of this thing that he might have to do, and I hope he doesn't. I hope he can get a transplant, but even that's not perfect. That is actually also really horrible. So those are the things that I worry about, and I find hope by connecting with other parents and really following medical research and donating to organizations, and that helps me. It brings me some peace because it gives me that little sense of control over this thing that I have no control over. But yeah, huge fears
Absolutely.
about those things.
Yeah, well, thank you for being so willing to share those and describe those to us. And I really want to thank our whole Zoom panel for everything you've shared with us in this morning's session. I do want to turn to the phones. I see that we have a caller. We have Jennifer from South Dakota that wants to speak to some of the fears that she has for the future for her son, who's almost 20, living with ARPKD. So Jennifer, I'd like to welcome you to the program. Are you with us?
Yes, I'm here.
Welcome. We'd love to hear about some of what you wanted to share about your son.
Sure. So this particular topic really spoke to me. My son was diagnosed in utero, so we knew before he was born. And the doctor specifically told us, don't go to the internet because it's not all true. He isn't necessarily going to die right away. We just need to get him, get his kidneys functioning and do what we can to deal with the symptoms. And of course, what did we do? We went to the internet. And so that kind of scared us a little bit. But luckily, he was only in the hospital for about 6 weeks. And even though controlling his blood pressure was a little tenuous when he was younger, we kind of got into this routine. It's like you kind of knew what you were doing. It was, you know, you'd go into the doctor, you'd go get your blood work done, you'd go have your scans done, check his blood pressure. You know, everything kind of created this, I guess what I call now kind of a false sense of security. Like you just knew what was going on. You felt like you had control of the situation. As long as we could control his blood pressure and make sure he was growing okay, everything was great. When he was 15, though, we knew things were starting to decline a little bit, and it kind of surprised us a little bit when the doctor said it was time to go for a transplant consult. But we're like, well, we knew this was coming, but it just like cropped up all those feelings from back before he was born. So it's like we felt like we were starting over. So with all the anxiety and all the worry and so we went through that transplant consult. And then for whatever reason that nobody's really sure what happened, but his kidneys stabilized, and so now we've been able to push that down the road a little bit. Okay. And so now we're getting ready to go for a second transplant consult here before the end of the year. This time we feel a little more better about it because like we know more questions to ask and things like that. But I think at this point now, the biggest fear is, are we making all the right decisions? Yeah. Medicine is an art sometimes more than a science, as much as we wish it were more exact. Yeah. And you have to place your trust in these doctors and the surgeons and, you know, everything. You just worry that you're making the right decisions. And now we have my son, who's almost 20, who also is really much the driver of those things. So it's hard. Sometimes it's even hard for me to take more of a back seat and kind of let him ask the questions, ask him how, you know, what he thinks, what does he want to do. And then we kind of make those decisions together. But for me, I think that is the hardest thing about this disease, is always wondering, you know, do you have doctors who are well-informed? Can you trust them? Luckily, so far, I think we have. But again, it's just that worry about, are you making all the right decisions in response to the care that they need? Yeah.
No, Jennifer, I really appreciate you providing these comments because, there's already so much uncertainty with the condition itself. And so, the uncertainty that goes into these treatment decisions and the outcomes, how well these treatments will actually work and the trade-offs, I can't even imagine having all of that, piled on top of just dealing with the uncertainty of the condition itself. So thank you so much for calling in and sharing all of that. I know we're just a minute over time here, but I do want to give the last word to any written comments that might have come in on this topic of worries and fears for the future.
Yeah, thank you for that, James. And we did have someone reach out from Pennsylvania and shared, even though at this point we have more kidney involvement, the fear of a GI bleed and the uncertainty of the liver side of the disease that could happen at any minute, I think, is what has a more impact on our life than anything. When it comes to kidneys, that is something that typically can be tracked and measured over time. But knowing that the liver can cause life-threatening complications at any minute has us living in fear of this happening any day. That was a really profound comment.
Yeah. Well, thank you for everyone who has contributed, everyone who called in, wrote in, of course, our Zoom panelists and our panelists that provided those testimonies to kick us off. It's been a truly profound morning of pulling back the curtain to understand what it is to live with ARPKD. At this point, we're going to take a break. We will be resuming at 1 p.m. Eastern Time when we're going to move into our second topic for the day, which is really understanding your experiences with different treatment approaches and what you're looking for from future treatments. So we hope to have you join us back at 1 p.m. Eastern. Thank you. Good afternoon. My name is James Valentine, and I'm here with my co-host Susan Bushnell from the PKD Foundation, and we'd like to welcome you back to the externally led patient-focused drug development meeting on autosomal recessive polycystic kidney disease, or ARPKD. I'd like to turn it over to Susan to introduce our afternoon speaker.
Oh, thank you, James. This afternoon's ARPKD expert is Dr. Max Lebo, who will be discussing the current state of research and therapies in ARPKD. Dr. Lebo is a pediatric nephrologist with training in cellular and molecular biology, who is well known for his translational research approach at the University Hospital Cologne in Germany. He also sits on the PKD Foundation's Scientific Advisory Panel. Dr. Lebo initiated and is currently leading the International ARPKD Registry Study, ARPKD, and is working to understand the long-term course of ARPKD to identify risk markers of disease progression. Over to you, Dr. Lebo.
Thank you very much for the kind introduction, dear participants. It's a really great pleasure to be here and to give this talk on the current state of research and an outlook for therapeutic developments for ARPKD. Again, thanks to the organizers for inviting me to give this talk. So this is my conflict of interest. And obviously, I don't need to introduce ARPKD to this audience very much. We all know it's a rare disease that can present clinically with very variable causes, and that mainly affects three organs. It can affect the lungs very early on, and then the kidneys and the liver. And today I want to very much focus on kidney disease in ARPKD, and you all know that this is characterized by enlarged kidneys, chronic kidney disease, and the enlargement is due to the cystic changes within the kidney. So treatment of ARPKD these days is very much symptomatic, and it's based on these consensus expert recommendations that came from an international conference that Lisa K. Woodford put together about 10 years ago. And still these recommendations very much are the pillar of what many of the centers do. But there are some questions that are still open, and some of these questions are whether we could identify patients that are at high risk for kidney disease progression and that could potentially benefit most from an early intervention. And then what would be a way to verify whether an intervention would be helpful for a group of patients with ARPKD? So, and to address these questions, various groups are working on clinical and translational aspects of ARPKD, and I'm just going to show you some examples. Lisa K. Woodford is working on clinical questions with a clinical database. We've been working on the effects of some of the genetic variants and what that means for the clinical course. Catherine Gell is using animal models to study imaging, and then on clinical base, Dr. Hartung is also working on imaging of the important liver disease in ARPKD. And for example, Laura Marcella and Thomas Seemann have worked on hypertension and cardiovascular aspects, and I do apologize to all the colleagues I could not name, but you see that many of these approaches are trying to study the clinical course of the rare diseases and to understand better how that disease develops. And why is that important? Well, I want to give you one example about the kidney disease. So what you see on this graph is how many patients with ARPKD reach certain age without the need of dialysis or kidney replacement therapy. So if you look at the graph, you see that by the age of 20, about 50% of the patients will need kidney replacement therapy, that is either dialysis or kidney transplantation. But what you also see is that there is this subgroup of patients here on the upper left side that I've circled that very early lose kidney function. So we've been studying these patients that are particularly high risk of kidney disease progression more in detail. And this has been a huge collaboration with many centers across Europe. And we looked at the clinical presentation of these patients to learn whether there's something that could help us understand early on who progresses rapidly to kidney failure and who may not. And to make a long story short, we could establish some antenatal findings that will not tell us for each patient in 100% whether he or she will progress to kidney failure early on, but that will, as a group, that have helped to identify risk factors associated with the early need for dialysis dependency. And we all believe that for studying rare diseases and for studying treatment in rare diseases, it is important to have a detailed knowledge of the disease causes and risk subgroups to set up clinical trials on therapeutic interventions. So another very important statement is that with such a rare disease, research is teamwork. And I thought I'd give you three examples of how that works these days. One national example here from Germany is the so-called NeoCyst Consortium. This is a group of various centers, human geneticists, pediatric nephrologists, etc. And we work together to really work on early onset cystic kidney diseases, try to understand the differences between the different types of cystic kidney diseases, so ARPKD, nephronophthisis, etc., and try to understand, whether there are joint disease mechanisms. Another important initiative that is in Europe is the so-called ERCnet consortium, where major centers in Europe have teamed up and jointly, so they exchange knowledge, they have jointly established guidelines, and the aim is to make sure that patients with rare kidney diseases have access to standardized treatment across the different countries in Europe. I should say that both NeoCyst and ERCnet are trying to actively involve patient advocacy groups in their work. And then the third very, very important initiative is the PKD Outcomes Consortium. So that was set up by the PKD Foundation together with the CPATH Institute, with researchers in the PKD field, also representatives of the pharmaceutical industry, of the regulatory agencies, etc., also of patient representatives. And obviously this was initially with a focus on ADPKD, but I'm happy to say that over the last years, there's also a growing interest in ARPKD, and what PKDoc is aiming to do is trying to facilitate the transfer of potential new therapies from research field to application in clinical life. So I mentioned PKDoc has a lot of work on ADPKD. So is there anything that we can learn for the ARPKD field? And here there's one important aspect. It was traditionally often believed that ARPKD would be an exclusive pediatric disease, whereas ADPKD would be an exclusive adult disease. But we've learned over the last years that there is a certain degree of overlap between the two, and that may include that some of the underlying disease mechanisms may be overlapping. So any treatment that is studied for ADPKD is like a natural candidate also for ARPKD treatment, although obviously it needs dedicated studying for ARPKD, specific studying for ARPKD. But what I wanted to show you is that there are a number of initiatives going on for ADPKD and how that translates into ARPKD. So tolvaptan, for example, obviously has made it to clinical application in ADPKD. And now there are the first two trials that are currently being launched or have been initiated in first US centers and European centers. And these are two trials. One trial to see if tolvaptan can delay dialysis in infants and children at high risk of early dialysis dependency in ARPKD, according to the criteria that I've previously shown you. And then a second trial to children who are a bit older. And here the main focus is on safety and tolerability. And it is important to state that these are the first phase 3 trials for ARPKD, so there is some movement in the field. So to summarize this, the development of targeted therapies for ARPKD has been hampered by the rareness of the disease and its variable clinical causes. We have learned that a detailed description of subgroups of patients with ARPKD is a very important base for the development of clinical trials to assure comparability of patients included in trials, but also to identify those patients that would have the greatest benefit from treatment. Therapies in ARPKD may need to independently target lung, kidney, and liver disease, but obviously for clinical trials, all aspects need to be considered for safety, reasons for safety aspects. And the first phase 3 trials have been initiated for tolvaptan in Europe and the US, and we will see what we can learn from these trials and how they develop. So with that, I've come to an end. I want to thank the collaborators, my group, funding agencies, etc., you all for attending this wonderful meeting, which I think is very, very important. And I'm looking forward to the discussions and to now hearing how treatment is perceived from the patient perspective. Thank you very much.
Thank you so much, Dr. Lebo, for that overview of the treatment landscape and clinical trials for ARPKD. It's going to help set a great foundation for our discussion this afternoon as we now transition our discussion with the ARPKD community into their experiences with current treatments and as well as their preferences for future treatments. So to help give us all a sense of what it is we want to explore together this afternoon, I'm going to pull up a set of discussion questions that we'll be using and walking through together as a group. So in this afternoon session, as I mentioned, we're focusing on current and future approaches to treatment. So some of the things that we'd like you to weigh in on are, what are you currently doing to manage your loved one's ARPKD and its symptoms? How well do those things that you're using, or maybe even things you've used in the past, help treat the most significant symptoms and health effects of ARPKD? All of those wide range of things we heard about this morning. Now we'd like to know, how well do different treatments help manage those different symptoms and health effects? We also know that regardless of whether or not something may be actually helping, there may be different downsides or trade-offs that come with those different treatment approaches. And so we want to know, what are the most significant downsides to your or your loved one's current treatments, and how do they affect daily life? As we discuss all of these different current treatment approaches, I want you to think about treatments in the broadest sense of the term. We, of course, are interested in medications, including medications for particular symptoms, like high blood pressure, or that are being used off-label, even though they're not approved specifically for ARPKD, but also different medical procedures. Obviously, transplants and dialysis are important treatment, the treatments that we've already heard and were mentioned earlier today. But even a broader range than that. So maybe less traditional, kind of treatment approaches, more holistic treatment approaches, even, different things like diet and exercise or lifestyle modifications. Really, anything that you or your loved one with ARPKD do to try to make life with the condition a little bit easier. We want to hear, again, what's worked, maybe what hasn't, and what are the downsides. Once we explore those current treatments, you'll see here the last question we want to explore with you is, short of a complete cure, what specific things would you look for in an ideal treatment for the condition? And what factors would be important to you in deciding whether to use a new treatment? So we'll spend some time at the end of our session today going over those topics. But to get us started in sharing their experiences and some of their preferences, we have another panel of people living with ARPKD and caregivers. We have Shauna, Jordan, Michelle, Colin, and Ashley. Shauna, why don't you take it away and get us started?
20 years ago, I was told I had a fatal condition and I wouldn't be here today. Countless times I've heard there's nothing I can do for you, or I don't know how to deal with your illness since I received my diagnosis of Autosomal Recessive Polycystic Kidney Disease and Congenital Hepatic Fibrosis at the age of 4. My name is Shauna Webb and I live in Morgantown, West Virginia. On my journey with ARPKD, I've never had one continuous specific treatment. Symptom management has always been the top priority. Which symptoms I'm managing has changed drastically over the 20 years I've experienced with this disease. When I was first diagnosed, the only symptom I presented with was an enlarged spleen. My pediatrician accidentally discovered this, and when my spleen never returned to its normal size, she pushed for me to see a specialist. For the first 5 years, the top treatment was to keep my spleen from rupturing and to control my blood pressure. This sounds easy, but try telling a 5-year-old this means no sports, no gym class, no carnival rides, no bike rides, no roller skating, and the list goes on. To add an extra layer of protection, I had a spleen guard I wore every single day, everywhere I went. A couple of years later, during a routine endoscopy, the next major symptom I encountered was esophageal varices. Every year or so, I would have to undergo an endoscopy to check the size of the varices, to see if new ones had formed, and if I had to have any banded to prevent bleeding. There wasn't a medication to get rid of the varices. The only way that I could manage this was by avoiding foods that could be sharp like potato chips and by having a plan of action to stop the bleeding if they ruptured. I was more susceptible to bleeding because I had lower platelet counts due to the enlarged spleen. To help with this, my doctors put me on vitamin K to help with the clotting. Fast forward to when I was a teenager, the vein in my spleen clotted off. At this point, it was time to remove my spleen. Once they removed it, I had an entirely different set of problems. My platelets skyrocketed. I had to start a Negrelide to get them under control. I underwent a round of vaccines and started taking penicillin for my weakened immune system. I had to have 4 endoscopies the next year to address the varices that popped up after my surgery. I was diagnosed with severe acid reflux and had to be cautious of which foods I ate to avoid being in pain. I was fortunate that my checkups were routine after the splenectomy up until I was in college. My liver and kidney functions have always been decreased, but never to a point where my doctors thought it was necessary to treat with medications or surgical intervention. Results of my routine MRI showed that my liver had developed nodules and was changing shape. Every 6 months since that appointment, I have imaging done to check the nodules on my liver and whether they appear cancerous. A year or 2 after the initial nodules developed, I was admitted to the ER with severe abdominal pain. I had 2 large blood clots, one in the portal vein and one in my mesenteric vein. I was started on Xarelto and will likely continue for the rest of my life. I still continue my regular MRIs, blood work, and checkups every 6 months. Aside from all the medical issues I've experienced growing up, having a chronic illness affects all parts of your life. I missed lots of school, and even on days I didn't miss, getting out of bed was a struggle. Nothing prepares you for the fatigue, and on top of that, there are days you just feel so isolated, so different from your peers, and not being able to participate in the same ways they are. Having gone through all of this, I really wanted to find a way to get involved with PKD research. I'm currently involved in a clinical research study with Cleveland Clinic. The study focuses on using imaging to gather information and determine how ARPKD progresses. I would like to get involved with more observational studies if the opportunity came up. However, I'm not comfortable participating in drug trials until I start to see a decline in my liver and kidney functions. I haven't had a liver or kidney transplant yet, and I'd like to prolong transplant as long as possible. Ideally, short of a cure, my goal would be to see new medications on the market for treating ARPKD. At a recent doctor's appointment, I was not a suitable candidate for the medication options available to slow ARPKD. One of the medications directly impacts and could further damage my liver. And as someone who also has congenital hepatic fibrosis, this medication would not be worth the risk. The other medication would lower my blood pressure to a dangerous level. I personally would focus on developing a drug that treats kidney disease, but is also safe for individuals with liver disease and vice versa. In addition to new medications, I believe it could be beneficial to have clearer, more specific diet and exercise recommendations that aren't just to simply drink lots of water. Living with ARPKD is not linear. There are a lot of ups and downs. Symptoms can change, treatments can change, and each patient has their own set of unique challenges with this ugly disease. But this has been my journey with ARPKD. Thank you.
Dear Hugo, I write to you in the year 2023. Today you are a strong, thriving 9-year-old entering the 4th grade. But it wasn't always that easy. When you came into the world, we nearly lost you. You spent the first few years of your life in and out of the hospital. Your stomach was large from 2 giant diseased kidneys, and every time you caught a cold, your lungs strained to breathe. We would inject you with growth hormones every night so you could gain strength and maybe even outgrow your big kidneys. And then we nearly lost you, again when you were about 2. It was a night that's just too painful for me to even talk about, but suffice it to say that you surprised us. And you stayed in the hospital for 3 weeks and you came out fighting for your life, and incredibly, you made it. When you were 4, we took you to Stanford, where you got a kidney transplant from mommy. Basically moved the whole family to California for 2 months in order to make sure that you got the absolute best care possible. They took out your 2 sick kidneys and replaced it with mom's healthy kidney. And almost immediately you were healthier, stronger, and you played until your hair was sweaty and your face was pink with, sweat and warmth. And it was just an amazing transformation. But still, it's not easy. You have shots, you've got labs, you have doctor's visits, you get sick easily. Transplant life is better than the alternative, but it's still not ideal. That said, the last 5 years since you had your transplant have been a joy. You've learned to read and write, ride a bike and snow ski and make friends, and you've started to, really understand your kidney disease and how to manage your health. At our family home in Denver, you play with your twin sister Juliet and your younger brother Cyrus. And, you did an amazing job of taking your meds, 6, 8, 10 pills every day. And you'll have to take these pills for the rest of your life, no question about it. Hopefully you always will. And when you get older, you'll continue to take your medicines because lots of teenagers forget and they lose their kidneys as a result. All this said, in the back of my mind is this terrifying possibility that these good times won't last forever. Because in the end, unfortunately, you'll have ARPKD for the rest of your life in some form or another. And the reality is that you're actually the first generation of kids with ARPKD who will make it to adulthood. And there's aspects of the disease that doctors have never seen before. So you're a pioneer. One day, mommy's kidney will probably stop working and you'll need a new one. And as we know, kidneys are not easy to come by. You might also, by the way, need a new liver, which is even scarier. And this is the part of ARPKD that really doesn't get much attention. I mean, look, transplants are miraculous, but they have all their own issues. And transplant, your immune system is weaker, it puts you at all sorts of risks for other diseases like cancer. And so for all these reasons, I'm writing to you with a message of hope and also empowerment. I want you to take advantage of every treatment available, no matter how imperfect. Well, yes, no matter how imperfect, but so long as they're safe, right? But I also want you to push your doctors and the medical community to do better. You and the next generation of ARPKD kids need treatments to slow the progression of the disease in the liver and the kidney. And you need a high quality of life without living with the constant fear of organ rejection, cancer, organ shortages. Look, Hugo, you and your siblings are my greatest joy. You've accomplished so much. It is time for science to step up and do their part. Right now, there's nothing available in the form of clinical trials, And I don't even know whether we would do them given, the risks. It's a conversation we want to have with you and make you part of it. But it's something that I would absolutely want to have an open mind to. And if there were any experimental therapies out there, we would certainly take a very hard look at them because it could mean giving you an even better quality of life or the next generation of ARPKD kids. I love you and thank you for all that you do.
Hi, my name is Michelle Carl, and I live in New York with my husband and our 3 boys, who are 23, 20, and 17. Our 23 and 17-year-old sons, Max and Gabe, were diagnosed with ARPKD in 2006 when Gabe was born. They both have not yet needed kidney transplants and have kidney function in the 60% range. They also appear to be on the milder side with the liver component, called Congenital Hepatic Fibrosis. Over the years, we have participated in 4 studies. Our first study was in 2007 when we went to the NIH to participate in their ARPKD CHF study. We went to the NIH 4 times over the last 17 years for this study. During our time there, the boys had numerous ultrasounds, MRIs, blood draws, urine tests, blood pressure checks, psychological testing, and so much more. We met with many doctors, including the geneticist running the program, the hepatologist about their liver, dietitians, nurses, etc. The NIH shared the results of all of their tests, including the DNA tests, which identified their specific mutation of the disease. The downsides of this study was the poking and the prodding and all of the tests the boys had to do. They particularly did not like the 24-hour urine tests or the 24-hour blood pressure checks. We also had to travel to DC and stay for about 3 days each time we went. The second study we have participated in was the Chronic Kidney Disease in Children study, which is a multi-center observational prospective cohort of children, adolescents, and young adults with a history of mild to moderately impaired kidney function. Only Gabe qualified for this study. This study was done through our local nephrologist at Mount Sinai. Gabe started this study when he was 5 or 6 years old and has gone once a year for the past 10 years. This study involved blood draws, urine tests, a physical exam, filling out surveys, psychological testing, and more. One benefit of this study was the knowledge we were providing information to the doctors so that they could use it to learn more about chronic kidney disease in children. We also received the results of the blood tests. The main downfall was it was not an ARPKD specific study and really didn't benefit us overall as far as PKD. The third study that we've participated in was through the Cleveland Clinic. This study is being done to better understand how certain MRI techniques can be applied to measure disease progression in ARPKD patients. While participating in this study, the boys had 2 MRIs a day apart and also had ultrasounds and did blood work and urine tests. The main benefit of this study is for the greater good of children with ARPKD and CHF and really doesn't benefit my boys. We didn't learn anything from the MRIs. We did receive their blood work results, and if there were any incidental findings or any findings of concern, we would have been told of them. As a parent, I can see the benefits of this type of study, but it was very hard for my boys to see the benefits, especially Gabe. Also, Gabe had a very hard time with the MRI and felt that the camera resting on his abdomen during the MRI was very heavy and painful. He has expressed that he does not want to return for the next visit. The last study we participated in was in 2022 at the Children's Hospital of Philadelphia. It was a 2-part study. The first part included 2 MRIs of the liver and kidneys. Only Max participated in this part because Gabe really did not want to do the MRI again because of his experience in Cleveland. The second part of the study was a brain MRI to look for ARPKD-related aneurysms. Originally, it was thought there was no correlation between aneurysms and ARPKD, but recently there have been a few children with ARPKD who have had brain aneurysms. One family in Pennsylvania who had a young son with ARPKD who passed away from a brain aneurysm. They helped fund this research grant. The benefit of participating in this study was that we did receive the results, and it was a big relief to know that neither of my boys have brain aneurysms. Another benefit is for the greater good of the ARPKD community. The downfalls of this study are the traveling and having to do the actual testing. Over the years, my sons have tried to eat a low-sodium diet and also to drink a lot of water. Max drinks a gallon of water a day. Gabe has a harder time drinking that much water. Max has also tried acupuncture over the years. Unfortunately, it's hard to know if the acupuncture, low-sodium diet, and water intake has helped at all. The main problem with ARPKD is that every child presents so differently, including my two sons, and there are no endpoints to target. The challenge for me as a parent is to figure out a balance as far as living a normal life and giving my children a typical childhood while managing the day-to-day of having children with chronic kidney disease. My ideal treatment would be a pill that helped their kidney function stay stable. My hope is that technology will continue to improve and they can live long, healthy lives with their transplanted kidneys when the time comes.
Hello, my name is Elise Hoover. I work at the Polycystic Kidney Disease Foundation. I am going to read a statement from Colleen, who was unfortunately unable to join us today. Hello, I will briefly discuss my relationship with ARPKD, how it's impacted our lives, and more importantly, my thoughts on how this chronic progressive disorder can be helped. My son was diagnosed prenatally and given no hope for survival with low amniotic fluid, which is essential for lung development. After exhausting second opinions and research, funeral arrangements were made. When I had no amniotic fluid remaining, I was induced. My son was whisked away after a weak cry and remained hospitalized for 3 weeks for breathing and blood pressure issues. He was eventually discharged home with 3 hypertension meds for BP readings in the 200/100 range. Shortly after his discharge, I was sent a Dynamap, an automated blood pressure machine typically used in the intensive care units to obtain accurate blood pressure readings. This was provided by our insurance company to titrate hypertension meds and avoid rehospitalizations. There were many med changes in his first year of life with growth and development. He grew slowly and experienced failure to thrive. Every day I would spend hours feeding him, later coaching him to eat. At the time of his birth, ARPKD babies routinely passed away. That was the expectation, not the exception. I feared he would die his first year of life. By 2 years of age, he did not speak and required speech therapy. And by the time he was a toddler, I normalized his life as much as possible with exceptional support from his pediatric nephrologist and GI specialist. Eventually, he was placed on growth hormone and experienced great success with no side effects. He excelled in school, played sports, and was a happy child. Soccer became his favorite sport, and this was made possible with a spleen guard, a hard piece of molded plastic individually fitted over the abdomen to protect his enlarged spleen that was displaced below his rib cage. These were periodically replaced with growth. Routinely, he visited his specialist twice a year. My son experienced acute renal failure, and on his 23rd birthday began hemodialysis. 11 months later, he was offered a kidney and liver transplant. Dual organ transplants are medically more complicated than just a kidney transplant and require more surveillance and follow-up. He did well for a long time, but last summer he developed abdominal pain and was admitted to the hospital. This was the beginning of a month-long hospitalization resulting from a viral infection that wreaked havoc. It was horrifying to witness. Rapid kidney and liver failure that included liver enzymes in the thousands, jaundice, and pitting edema that wept and saturated thick pads within an hour. He experienced confusion, was difficult to awake at times, and would moan with pain when his abdomen became rock hard from fasciitis. This required several liters of drainage every few days. When nothing more could be done, he was placed on a transplant list with a MELD score of 39 and was gifted with a new liver and kidney within 12 hours. He was incredibly fortunate to survive that harrowing ordeal. He is now in his early 30s, independent, productive, and manages his post-transplant care well. Transplant is not a cure. You are essentially trading one set of medical issues for another because transplant has its own set of lifelong medical issues. Except for improvements in generalized care for prenatal, renal, and transplant, treatment for this disease has not changed since my son's birth. There are no specific treatments for ARPKD, and since it begins early in fetal development, he had significant kidney and liver involvement at birth. I prefer to address ARPKD as autosomal recessive polycystic kidney disease and congenital hepatic fibrosis, or ARPKD/CHF, because this acronym paints a clear reality for those living with this condition. If you have ARPKD, you can always have some degree of CHF. CHF may not be problematic, but often progresses with age. There can be inverse relationships between ARPKD and CHF, early severe kidney symptoms followed by liver symptoms that progress with age. But many individuals like my son have manifestations from both organs. He was treated with standards of care for end-stage renal failure. That is our renal treatment in this disease. ARPKD is not just a kidney disease, and our needs remain largely unmet. In my world, a strong focus on congenital hepatic fibrosis is created, not just on diagnostic criteria for CHF, because that is a given with ARPKD, but on effective, meaningful treatment modalities, including new and repurposed drugs aimed at both ARPKD and CHF.
He will be on dialysis. He may need a tracheostomy. He may be dependent on the ventilator. He may need 24-hour care. He may never walk. He may never talk. We don't know what his cognitive function or his quality of life will be. These are the words we heard in a small private room next to where our 2-month-old son, CJ, slept. Our only child, now on life support after coding twice that day. His lungs, underdeveloped from the large cystic kidneys he had developed in utero, were struggling to oxygenate his body despite the life support from the ventilator. The words came out of the neonatal intensivist's mouth, slowly, almost surreally. Was this real? How had this all happened? Just a few weeks before, we thought we might be going home soon. But it was real. This was real life with ARPKD. My name is Ashley, and I am mom to my son CJ, who lives with ARPKD. His father and I had been on the other side numerous times, as an adult pulmonary critical care physician, him, and myself, an adult nephrologist. Now we were faced with the care of a child on dialysis and a ventilator. Now this was going to be life with ARPKD. CJ's kidneys grew from a length of 8 centimeters at his premature birth, compared to a normal of about 5 centimeters in a full-term baby, to 13 centimeters by 3.5 months old. We knew this to be an underestimate, as his abdomen was too distended and domed for the ultrasound probes to lie flat on the surface and fully capture his kidneys. Since his extubation, he had remained on non-invasive respiratory support. He was growing very slowly as he was unable to take anything by mouth, his breathing prohibiting this. He received fortified breast milk by feeding tube, but he was only able to tolerate small amounts as his kidneys left little room for his stomach to expand. At 3.5 months, he rarely smiled and always looked uncomfortable. At that point, he had actually come off dialysis for a few weeks, but when his breathing got worse and he again had to be reintubated and placed back on the ventilator, we made the difficult decision to proceed with nephrectomy to try and save his life. Difficult not only because we were committing him to dialysis and eventually, hopefully, a transplant, but also incredibly difficult because he had rapidly become so critical, we were not sure whether he would survive the surgery. On the precipice, his surgeon said. Fortunately for CJ, the nephrectomy helped and he was extubated a few days after his second kidney was removed. Back on dialysis, but doing better. And those kidneys, those 13 centimeter kidneys, they turned out to actually be 15 and 17 centimeter kidneys when they were removed. Almost 50% larger than full-sized adult kidneys, crammed into the belly of a 3.5-month-old baby. That was life with ARPKD. We left the hospital for the first time 2 months later at 6 months old, on peritoneal dialysis and with a feeding tube, but on oxygen via nasal cannula only. He made no sound when he cried, his lungs still too weak. He couldn't sit up or on his own or lift his arms against gravity, a complication of his prolonged recurrent critical illness. Most of that time I remember as a blur, life so intense and tenuous. That was life with ARPKD. At home, finally, he slowly improved, and I was able to donate a kidney to him when he was 16 months old. Soon he was sitting up, trying to mobilize, alert and curious, and playing like he never had before. The fog had been lifted. He finally walked at 2 years old. He is now 3.5 years old with a well-functioning transplanted kidney. He is no longer on dialysis. He does not have a tracheostomy. He is not dependent on the ventilator. He does need high-level nursing care. He walks. In fact, he nearly runs. While he is speech-delayed, he does talk. "Oh man," was a recent addition. CJ loves books, Moana, and his family. He is bright. And although his is not an easy life, it is a full, wonderful life. And he is the absolute light of our lives. This has been our life so far with ARPKD. Treatment options for the rapidly growing kidneys that can occur with ARPKD is a critical need. For children like CJ who present with ARPKD in the neonatal period, the risks are high and prognosis can be grave. 1 in 3 do not survive. It is quite literally life or death for these babies. CJ narrowly avoided being a part of the statistic, but he was not unscathed. I can tell you that time, it was the hardest of my life. And I hope for a day that no other babies and their families have to endure the same. And although CJ survived the renal complications of ARPKD, we live with the knowledge and fear that ARPKD invariably affects the liver in all children. Though the cyst will not recur in his transplanted kidney, his disease continues in his liver. It may eventually lead to cirrhosis and a need for a liver transplant to survive. And there is no equivalent to dialysis for liver disease. There are currently no treatment options to help delay or stop the progression of his liver disease. And therapeutic options for the management of liver disease and ARPKD is a critical need. This is life with ARPKD.
Thank you so much, Ashley, and to all of our panelists this afternoon, helping us understand the different treatment approaches that are currently available, your and your loved ones' experiences with those different treatments, but also for beginning to help us understand what would represent a meaningful future treatment for this condition. So now we're at the second opportunity we have today to broaden the discussion to all of you in our live audience. As a reminder, we'll be doing polling questions, asking for you to call in, as well as submit written comments that we'll read out. But to get us started, we're going to go to polling, where we're going to ask a few questions about some of your treatment experiences to get an idea of the experiences of our audience and to get you all thinking about some of the different experiences you might share with us. So if you have that website open, you can go there now. If not, for all of our patients and caregivers, please go to www.pollev.com/ARPKD. Again, that URL to type in right now is www.pollev.com/ARPKD. Keep this up for the remainder of our afternoon session. As we go to different polling questions, you'll be able to answer those as we go. So our first question for you this afternoon is focused on medications and medical treatments. We'll go to some of the other broader treatment approaches in our next question. Here we want to know what of those medications or medical treatments have you used, either currently or previously, to treat the symptoms associated with ARPKD, CHF, or other related conditions. And here you can select all that apply. The options are A, prescription iron supplement, B, corticosteroids, C, splenectomy, D, dialysis, E, growth hormone, F, kidney transplant, G, liver transplant, H, blood pressure medication, I, bowel medications, J, sleep medications, K, antidepressants or anti-anxiety medications, or L, some other medication or medical treatment that you've used either currently or in the past to treat the symptoms associated with this condition. I'll just remind everybody that this is our first question this afternoon, where our audience members can select more than one option. So the percentages you're seeing are not a percentage of people that picked any one option, but a percentage of total responses. So the way that I would encourage you to look at this is kind of relative ranking based off of the size of the green bar. So we'll give you a few more moments here to get in your responses. As it stands, it looks like some of the top medications and medical treatments being reported used by our audience today are blood pressure medications, other medications, so we really want to hear what those are, things that we didn't list as a response option here, as well as prescription iron supplement. After that, we see bowel medications and growth hormone as some of the next most used, followed by corticosteroids, kidney transplant, and dialysis, as well as sleep meds. Everything here except for liver transplant is being reported as experienced by our audience today. So we can move to our next polling question. So while the first question focused on medications and medical treatments, here in our second question, we want to focus on some other broader kinds of approaches to treating this condition. So what have you or your loved one used to help manage the symptoms of ARPKD, CHF, or other related conditions besides medications and medical treatments? And again, you can select all that apply. The options include A, physical therapy, B, a low-salt diet, C, other dietary modifications, D, acupuncture, E, CBD, F, other dietary supplements, G, speech therapy, H, a spleen guard, I, a feeding tube, J, counseling or psychotherapy, K, some other treatment approach that we haven't listed, or L, we are not currently doing anything to manage symptoms. So we'll give you a few more moments here to get in your responses to let us know everything, beyond medications that you've used either currently or in the past. As it stands, it looks like the low-salt diet is the #1 most experienced treatment approach, followed by other dietary modifications. We also see higher rates of dietary supplements, physical therapy, and counseling and psychotherapy being reported, as well as some other things. Everything here is being reported except for acupuncture and CBD, and we do see some individuals reporting that they're currently not doing anything to help manage symptoms. We, of course, want to hear from not only those of you that have experience with treatments currently, but also those of you who maybe have chosen not to undertake any treatments, and help us understand why that is, maybe depending on where you are in your progression or journey with the disease, or based off of the characteristics of the treatments that are available to you. One more question here to get us started as part of this afternoon session. In this third question, I want you to think about all of the different medications and other types of treatments that we listed on the last two. I want you to think of them in total. How well does your current treatment regimen treat the most significant symptoms of ARPKD? The options are A, not at all, B, very little, C, somewhat, D, to a great extent, or E, not applicable because I'm not using anything. And as you're making this selection, I want you to think about, what treatments are you thinking about? How, what things have helped? If they've helped only a little or somewhat, how would you capture that, or describe that benefit that you did experience, and how is that? What else would you need or look for from future treatments? Given that rating. For those of you who have selected to a great extent, we want to hear, what are those successes? What symptoms did you or your loved one have, and what treatments helped really, alleviate those symptoms to a great extent? So as it stands, it looks like about, a little over 50% of our audience has said somewhat. We see about equal people saying very little, as well as to a great extent, and then about 5% of people saying that this is not applicable because they're not using anything. Nobody reports that current treatments do not help at all. So I want to thank everybody for participating in those polling questions. If you'd like to share some of your treatment experiences, we want to invite you to call in. The number to call in is 1-703-844-3231. Again, you can call in now at any point during the program to share your treatment experiences at 1-703-844-3231. You could also, there's a comment box under the live stream on the webpage today. You can also submit written comments to these different discussion questions, and we'll be reading some of those out throughout the course of the session. Know that if we don't get to your comment, we're not able to read it out, we will capture it, and it'll be available for the Voice of the Patient summary report. So while some of you are calling in and writing in, I'd like to welcome our Zoom panel, some of your peers who are joining us today to also help share some of their experiences with current and future treatments. I'd like to start with you, Alex, and in terms of, there's so much for us to cover in terms of different treatment experiences. I'd like to maybe start us off today with the things that have been most helpful. And we saw that there was a range of different, how helpful things that are helpful might be, for you all. But as you think and reflect on that, I'd love to hear, what your experiences have been.
Sure, thank you so much. My name is Alex, and I'm from Virginia, and I have a son with ARPKD. He was diagnosed at 5, and he's now 11. And he right now he is on blood pressure medication, which is I think the thing most of us manage and use to manage the ARPKD, because that's really one of the only thing that's available. And high blood pressure is common for all of us. So we've also tried some additional supplements. There's not really a lot out there that our doctors can help us with. It's really frustrating to go to the doctor and have them say, these are the things that we're going to look out for. These are the treatments when those, things that are available to us when they happen, but there's really not much we can do. And as a parent, as a mother, it's excruciating to just think that there's really nothing. So I think within this group, I know a lot of the other parents on this panel, we call each other and we say, what are you doing? What are you using? I know that we, probiotics are something that we try just to keep his system regular, and that we think seems to be helping. We're lucky he's an easy kid. At 5, when we left the doctor and they were like, just trying to get him to drink as close to 2 liters of water as possible. Yeah. I know adults that can't do that. Yeah. And so I told him I'd buy him any water bottle he wanted, multiple colors, everybody in the family got one. And this was it. I mean, that was the extent of what was available and what we could do, but we had to do something. Yeah. So we've continued to just talk to other parents, and for us right now, there's also a fear, I don't want to introduce a supplement that isn't tested, or we don't know how it's going to impact one organ or the other. I think the tricky thing and the scary thing with ARPKD is that it's both kidney and liver. Yeah. So anything you ingest, whether it's medication or food, it's going to be processed through one or the other or both. Right. And so while it may help one organ, it may hurt the other organ. And so to find that balance is really scary. And so right now, our main focus again is just making sure he has enough water. I told this to someone yesterday, and they were like, I'd be really concerned if I left the doctor. And they said, the best thing you can do is drink more water. But that is what we try and do, and just keep him at a healthy weight and a healthy diet, and go from there and hopefully see what is available to us next.
Yeah. So Alex, one of the things that you kind of started off talking about, and I have a couple of questions for you, but to start, one thing you mentioned was the blood pressure medication, and it's, you kind of said it's like maybe the primary thing that you have available to you. How well is that working to manage, blood pressure? What benefits is that providing?
We were really fortunate that it worked very well. He was on enalapril first, which he was able to take as a liquid, because at 5 he couldn't swallow pills. And so when he started to grow and get a little bit bigger, the doctor felt that switching to lisinopril would be a better option for him as he grew. And so what we did was, he was, again, we're really fortunate he's up for a lot of things. We tried swallowing mini M&Ms to get him to be able to swallow pills. And so that was our introduction to that, and he did a really good job. So the blood pressure medication so far has worked, and we continue to monitor his blood pressure at home just to make sure that he doesn't need an increased dose at any time.
I see. The other thing that I want to follow up on was you mentioned probiotics, and that has seemed to help with some of the GI issues. Can you maybe highlight what some of those GI issues were, and how did you notice, some of the improvement you saw?
Sure. Actually, before we knew he had ARPKD, we were constantly dealing with constipation. And so for the amount of apples that he likes to eat, I was like, how is this possible? And so we would use Miralax, which of course is a synthetic, which is fine and it works. But I wanted something that we could give him every day that would kind of help his digestion. We consulted the doctors and multiple nutritionists, and they were like, it's not going to hurt him for what, it's safe to take. And so that so far, it's just something easy that we add with his regular vitamins. It continues to help. I don't know how much it helps though, because he's also drinking 2 liters of water and eating broccoli and carrot and all of the other things. So it's hard to measure, but I feel like I'm doing something. Right. And so that's, I think, the trade-off.
Yeah, and I think it's totally fair and for everybody who shares today to acknowledge that it's really hard to know if certain things are actually helping or not helping. And so, we absolutely are trusting and want you to share almost from your intuition what you've noticed and experienced. So thank you, Alex, for sharing that. I'd like to bring Elizabeth into this conversation, thinking again, focusing first on maybe the things that have been most helpful. What stands out to you?
Yes, thanks to Alex or James and Susan. I appreciate that, and Alex for sharing your story as well. I'm Elizabeth. I'm located in Michigan. I have 3 children. My oldest is unaffected. My 13-year-old daughter is affected, as well as my 9-year-old son. So I think one of the biggest things that has been very helpful is, first of all, the community that we have within just the parents and just everything that we can share in that sense, because it really opened up my eyes a lot, and that there's other people that do experience these things as well, and to reach out to the providers that are knowledgeable. When we had our daughter, who was not diagnosed prenatally, but after she was born, we really had no clue, and we were not given a very good diagnosis at all whatsoever. But reaching out to people, we gained a little bit of hope, and we were able to be set up with providers who are knowledgeable. And I think the biggest thing that has been that we have learned from those providers and other families is the blood pressure medication, being very aggressive in that treatment, and even being trying to strive for the lower end of what's considered normal for our kids has maintained the quality of their kidney function, for longer periods of time. So we've learned a lot just with dealing with our daughter and going through all of that, and then subsequently having our son, who is diagnosed prenatally as well. So that, as well as just understanding what other natural, maybe supplements, different things that we can utilize as well. Yeah.
Elizabeth, can you maybe describe, so we understand it, what, aggressive, blood pressure medication looks like? And, is that something that, I'm interested in terms of, getting to that, was that you started a certain regimen and that's been the regimen that's worked, or has there been some, trial and error that went along to get you to the point of, I think, as you said it, being in the lower range of normal?
Definitely a lot of trial and error. Our nephrologist here currently in Detroit, he's amazing. He reached out to so many different doctors just to understand more, and really connected with other experts in the area to try and treat our daughter more aggressively. She was not compliant as a child, as a baby, with getting her blood pressure taken, anything like that. So she always ran a lot higher. And so it was maybe given the excuse of, well, she's upset, she's, in a weird environment, where it could cause that to be higher. And so it was just kind of brushed off. And so I think she dealt with higher blood pressure a lot longer than when 4 years later we had our son, who we treated it very, aggressively very early on. Right.
Yeah. Well, thank you for helping me, understand that a little bit, and understand, kind of beyond that, there's you mentioned trying to find things maybe more holistic or naturopathic approaches. Has there been anything that you've tried that you think has helped from that kind of set of different treatment approaches?
Yeah, so we've done different things. Just my older daughter, my daughter who's the older one who's affected. I mean, she's 13, so she's in therapy. She does a lot of different things that help. As a 13-year-old girl who is affected by this disease, it's very impactful for her at this age. Different things like that, just to help with calming, like just learning how to manage and mentally and emotionally deal with this disease as well and what it means for her.
Sure. Well, thank you so much for sharing, Elizabeth. Lisa, if I could bring you in on this topic. Again, we're exploring things that maybe have been the most helpful. What has been most helpful in your family's experience?
Thank you, Susan and James. My name is Lisa. I'm from Ohio. I have 3 children. Our oldest is 13, who has ARPKD. My son is 10. He is a carrier, so he'll have to look into, things when he has a family of his own on how to not carry on this gene. And then my youngest is 9, and she has ARPKD as well. My oldest is very, very much affected. Her kidney function is at 40%. She was not diagnosed until she was almost 4 years old. So I think that her really high blood pressure had something to do with that. She's on 4 blood pressure medicines a day. She takes some in the morning, some at night. She also takes iron supplements. She takes vitamins, a renal vitamin. She has really hard times with, she's tried omeprazole and several different types of acid reducers, and they seem to help, and sometimes they don't help. And along with those, we found too that you have to include calcium in your diet, extra calcium, which we didn't find out for a while. So things that have helped, I feel that the blood pressure medicines help definitely somewhat, but not enough to ever get it to where her blood pressure is supposed to be. And the more blood pressure medicines you take, the worse your kidneys get because they're damaging your organs. So it's kind of a trade-off to see, well, how is her heart doing? Is her heart okay now? Then we're going to stay at 4 before we add another one. This is kind of an interesting thing about my daughter. She actually has a dog, and she's trained her dog to be a therapy dog. And it's her therapy dog. And I know that this helps lower her blood pressure and calm her. And she doesn't take him to school, but she does take him to a lot of different places. So that's kind of cool that she did that herself.
Yeah, no, that's really cool. And like I said, anything counts as treatment that is being done to try to, help with symptoms, and certainly the calming effect of a therapy dog, sounds, really important. So a similar question that I asked of Elizabeth, I have for you, which is, you mentioned getting to these 4 medications, and you talked about what goes into some of the thinking about whether to add a 5th. But can you tell us maybe a little bit of the journey to get to the 4 that she's currently on, and I guess what's that balance of where you drew the line of benefit, because it sounds like that she could have more blood pressure reduction than she currently has, but against those trade-offs that you described in terms of being worried about damaging the kidneys.
So she started on I think it was enalapril when she was almost 4, and her left side of her heart was thickened, and that got her heart looking better. And then slowly but surely, her blood pressure went back up into the 120s over 70s, 80s. When she was first diagnosed, it was like 149 over 92. So from the time she was 4 until now 13, they just have to keep adding. And then the enalapril actually made her start coughing, and it was a weird side effect that I found out from other Facebook parents. So when people say you find out a lot about on Facebook, that's like our go-to as parents, because we have great medical care here in Ohio for sure. But sometimes you have to kind of look at a different aspect of something. Could this be from this? So she's definitely it's hard for her too to always remember to take pills. And sometimes I can remind her 3 times, did you take your pills? Did you take your pills?
Right.
And it's tricky, you know, like you have to, if she didn't take them, you have to drop them off at school because she has to take her morning meds. You have to take your, you know, night meds. As far as adding another one, I think that you just have to look at how much more, you know, she's sick every morning, she's sick every night, she has to eat with her pills, and it doesn't make a difference. So to add one more medication, you have to weigh the risks with the benefits.
Absolutely. Well, thank you so much, Lisa. I see that we have a phone caller. We have Aaron from Seattle, Washington, who has a 11-year-old son with a kidney transplant. So we'd love to bring Aaron into the conversation to describe this treatment approach and you know, her son's experiences with it. So Aaron, I'd like to welcome you to the program. Are you with us?
Yeah, can you hear me okay?
I can. Welcome.
Great, thank you. Yes, I have a just turned 11-year-old son and was diagnosed at birth with ARPKD. And for about the first 6 years of his life, his treatment was 13 different medications. You know, he was on different blood pressure meds, and he was on a phosphorus binder. And we were really, you know, managing his the disease through diet and meds. And just reflecting on that, that was really challenging because all of his meds, some were refrigerated, some were not. They all expired at different times. And, you know, just it was constantly juggling these meds that a lot of them didn't taste great and trying to get it down, you know, a kiddo throughout the day. They had to be taken at different points throughout the day.
Sure.
Was a challenge. And then when Bo turned 6, his kidney function declined really very low, and he had a nephrectomy and was put on dialysis. And then received a transplant from me when he just right before he turned 7, and he's been living with his transplanted kidney for 3 years now. And I just wanted to comment on how much of a change that was once he got his transplanted kidney and how life became much easier. And although we do still rely on meds, you know, he takes them less frequently and in a pill form and just twice a day.
Sure.
But really it is trading one set of kind of complications and challenges for another. You know, we do have to be careful about him getting sick, and with COVID, his transplant was right before COVID, and that was really scary. And, you know, honestly, he's got a lot of GI symptoms that he lives with, and while he has normalized them, I worry about as he gets older, you know, how is he going to view that and live with those symptoms and just kind of being more fatigued than other kids. And, you know, it's just not well, it's a great solution. It's not a perfect solution. And I wish for other PKD parents and the next generation coming up that there was a pill that could prolong the health of the kidneys and the growth, or slow the growth of the cyst.
Yeah.
And then also, you know, he hasn't had a liver transplant, but we do think he'll need one day. And it's kind of like waiting for the other shoe to drop with what's going to happen with his liver. And I wish there was a pill to either, like, you know, help with the cysts forming in his liver, not to increase as much. And then also, like, I wish there was some way to wave a magic wand and help with, like, the structure of his liver to be more healthy.
Yeah, well, I mean, this has been really educational for me, Aaron. Just if you don't mind me asking, you know, I have a pair of follow-up questions for you. One is, you know, you mentioned that, you know, basically after the transplant, you know, he was much better. I forget the exact words you said, but I just would want to know, you know, what is it that you, kind of what was in your mind when you said that? How did you notice, you know, that improvement after the transplant? And then I just want to give you an opportunity to also expand on any, you mentioned I think it was GI issues, and then of course the liver complications. have continued, post kidney transplant. So I guess I'm just really trying to understand what was helped and what wasn't post transplant.
Yeah. So, he really turned into a different kid in a lot of ways. He had a lot more energy. He was a lot more just alert, and he also got his appetite back. Like in the end, when his kidney function was really declined, he didn't want to eat anything. Food didn't really taste good to him.
Wow.
He just wanted to eat carbs, really, and once he got his transplanted kidney, his appetite really increased, and he wanted to eat a lot of different foods. And that was a big deal because diet's such a huge part of managing kidney disease and just health in general. So that was like one of the biggest things, was seeing his diet change and him being able to eat more healthy and a less restricted diet. And so, and then his stomach wasn't so large, and I'd say like diet and energy level were the biggest things. So just quality of life.
Sure. Oh, that sounds really important. Well, Erin, thank you so much for calling in and sharing those treatment experiences, both kind of sides of the coin with kidney transplant, but also thank you for sharing some of your thoughts about what would be helpful for your son in the future. I do see that we have some comments coming in talking about different treatments that people are using to some success. So Susan, I'd like to see what you have to say here.
Oh, thank you, James. Katie in Texas shares, we are doing what we can with diet, frequent lab and imaging, and blood pressure control. Additionally, Allie in Alabama, my son is on 2 blood pressure medications and is also on a low potassium diet. We also do weekly PT and OT, and we visit our local children's hospital every 3 months for lab work. And finally, Ashley in Georgia shares, my daughter was on sodium supplements as an infant as well.
Yeah. Well, thank you to everybody who helped share some of those things that have been most useful. I do want to, happy to continue to hear about success stories, but do want to broaden the discussion, knowing that maybe there's things that have been tried that haven't been as helpful, or even if they have been helpful or not, have come with some important downsides. And some of that certainly has already come out. We just heard from our caller about some of the trade-offs related to her son's kidney transplant. But to get us thinking about this, I'm going to go to a polling question. So this polling question, again, you can go to pollev.com/ARPKD, or again, that's www.pollev.com/ARPKD for our patients and caregivers. We'd like you to answer at this point, what are the biggest drawbacks of your and your loved one's current treatment approaches? And you can select up to 3. The options here are A, not very effective at treating the target symptom, B, only treats some but not all symptoms, C, the side effects, D, the route of administration, E, that it requires too much effort and or time commitment, F, some other drawback, or G, not applicable as I'm not using any treatments. And route of administration meaning, the route of delivery, whether it's taken orally as a pill or, given intravenously as an IV, or some other route of administration that you would view as being a drawback to a certain treatment approach. So we'll give you a few moments to think here about these biggest drawbacks. As it stands, it looks like the highest reported top 3 drawback is that it treats some but not all symptoms, followed by the side effects that are associated with the treatment. After that is, I think, a clear number 3. We see not very effective at treating the target symptom. We do see some in our audience reporting route of administration and the time and effort required as also being top 3 drawbacks for them. Nobody is reporting other or not applicable. So, like always, we want you to think about, what are the impacts of these drawbacks? Why did you pick them? What aspects of life or quality of life for you or your loved ones were impacted by these trade-offs? If you'd like to share your experiences, we invite you to call in at 1-703-844-9227. 3231. Again, that phone number is 1-703-844-3231. And you can also continue to submit written comments in that comment box under the live stream today. So I'd like to come back to our Zoom panel to start us off here. And maybe Frank and Carolina, you can get us started on this broader topic. You know, we're still talking about current treatment approaches, you know, whether it's, you know, something where we started, something that's been most helpful, but also now, you know, have there been any important trade-offs or downsides that you all have experienced from current treatment approaches?
Hey, Frank and my wife Carolina, where I live in Ponte Vedra, Florida, just below Jacksonville, and we have a 6-year-old son who was born or diagnosed with ARPKD pre-birth. So.
And now he's taking same thing in Elapril. It's actually funny that Alex mentioned the pill because we just switched it this week to pill. We're up to 5 milligrams, and he's actually pretty good. We are very fortunate. He took the medication when it was liquid very well. He actually liked the taste. And then the first day that he tried the pill, he got it down. So we more so like now listening to his stories, I feel like we're very fortunate. It's never easy to know that, you know, something else can happen and something can go downhill, and it can be unexpected, but so far he's doing really well. And I think that the salt part, the sodium side, is the hardest because at that age, and I'm sure all the moms will agree, we do our best at home, but it's that age that they eat out and they go to birthday parties, and then there's the chicken finger that's probably like loaded with sodium. And I feel like that's the hardest part, like to try to make it, how to balance, you know, like in real life, to make them feel like they have a normal life, but at the same time, remind them there's like, we call it the little dots in his belly that we need to make sure we're taking care of.
Yeah, and if you don't mind me asking, you know, you talk about the difficulty of the diet, and you know, can you, you know, what does, you know, mealtime look like? Can you kind of share, you know, an example of why, what, you know, how that's challenging with him?
Again, like I feel, I always liked to look for even before kids, so that part was easier for me. Cutting back salt, it was a little tricky because I'm from Brazil, and they literally put like a pound of salt every time they make something on their food.
Yeah.
But health-wise, like fruits and vegetables and, you know, that stuff was covered. So salt we got down, but for instance, he started kindergarten last year, and there's their canteen, and then we're, you know, he wants to buy food at school. So we made a deal. He can buy food once a week. But then if you think back, like once a week after a course of a year, that's a lot, you know, than me prepping. Like he loves peanut butter toast in the morning with chia seeds and honey and almond butter. So he eats really well. But then there's the weekends, and, you know, they get together with their friends, and we do enjoy going out, and he does too. So it's hard. Yeah, I think it's gonna get harder for sure.
Absolutely.
So.
Well, thank you both for sharing, you know, about those kind of, again, broad treatment experiences, diet being an important one. Ashley, would like to bring you into the conversation about current treatments. You know, how well is the, you know, current treatment regimen working? You know, any, you know, kind of highlights to share with us?
Sure. Yeah. My name's Ashley, and I'm from Missouri. I have 2 children. My youngest, who is 6, has ARPKD, diagnosed at about 18 months old. And our big challenge right now has a lot to do with belly pain and nausea. And so it gets a bit tricky with medications and treatments because, you know, she's on 3 blood pressure medicines, she's on Ursodiol, she's on iron, you know, all of these twice a day. And more common than not that she wakes up in the morning and either doesn't want to eat because she's not hungry, has belly pain, or has nausea. Kind of all of those work together as well. And so, it's not an uncommon thing for her to take her medications and then vomit them up, later, which causes us to miss school, or causes just a bad start to the day. She's in first grade now. And so that's our biggest problem right now, is that the pain and the uncomfortable aspect of having such a large abdomen and how that impacts with her medications. Right.
And I mean, is there anything that helps when there are the GI symptoms, the nausea, vomiting? Is there anything that is useful here, or is this really something that is untreatable for her?
For her, it's a sort of untreatable. I would say that on those mornings that she does feel that way, I don't force. If I force her to eat, she is going to vomit. So I encourage, just like an applesauce pouch or a yogurt stick or just something. So there's something in her belly to help, cushion it when she takes her medications. Yeah. And I would say that there are times that she'll take her medication, she'll go to school basically with an empty stomach. But then by the time she gets to school, if we get there early enough, she might be able to have a school breakfast if she turns things around. And then also at school, they have snack before lunch. So, she's not going completely without food until lunchtime, but she complains frequently of pain. And so I would say that is our biggest downfall of the disease right now.
And that's abdominal pain.
Yes, she's old enough now that she talks about different types of pain differently. I think that they're both related to the size of her abdomen, because sometimes she'll be able to point to, an upper area or a lower area or all in the middle. And you can kind of then gauge whether this is nausea or this is pressure. I see. And sometimes it's, just there when she wakes up, but then also it's frequently brought on by exercise or exertion.
And similarly, nothing that really helps with that pain. Yeah.
No, rest for exercise. We noticed in the past probably 2 years, kind of since she's grown out of the stroller, that any sort of activity like going on vacation or to a theme park or anything like that, I think it is that her abdomen is so large that it's just exhausting and painful. And she gets those side stitches. So there's a lot of carrying. I mean, she's 6 now and not, a baby anymore. So we end up giving lots of piggyback rides and carrying her because she really just can't make it.
Wow. Well, thank you so much, Ashley, for sharing. Lisa, I'd like to come check in with you. I think there might have been a couple of additional treatment experiences that you wanted to share.
I did. Thank you so much. So we had tried an herbal supplement for our oldest at one point, and it actually put her in the hospital with cholangitis. Oh, wow. And so it's kind of scary when you're trying things that aren't necessary. And they were actually using that medicine that we tried for ADPKD. So we thought that it would be safe, and it wasn't. And obviously we don't do it anymore, but it's just hard as a parent or even as a child with this disease, because you tend to normalize everything. Like, this is our daily life and this is what we do. And you don't realize until you maybe see other families that don't have to worry about, did I pick up the prescription? Did the prescription get called in? Is my medicine, I know the caller had mentioned something about like medicines expiring. I spent 3 months on the phone with a growth hormone company trying to get my daughter's growth hormone processed, because something had changed in their computer system, and it wasn't even anything that I did or my insurance company did. And eventually I had to actually write to the CEO of the company, and everything was magically fixed and we were able to get her back on growth hormone. But just the fight that we have to go through as parents and the amount of time that it takes, And sadly, none of this is a treatment, like we've said. It's all just kind of managing the symptoms until they get a kidney transplant. And then after kidney transplant, like everyone has said, it's just now managing new symptoms to a disease that has no cure.
Yes. Thank you so much for sharing that. I'd like to check in with the panel broadly here before we shift gears on topics. Any other either things that you've tried that have not worked, or treatment downsides that any of you would like to share today? You can just give me a little wave of a hand if you do. Yes, Alex, and then we'll come to Elizabeth after.
Yeah, and since our son was diagnosed at 5, it's funny because a lot of times the other things that parents say trigger that, oh yeah, we did that too, because there are so many things that you don't know if it's specifically connected to the disease, and you don't want to blame everything on the disease. But my son has been in PT and OT since he started school. And so it's almost like he's constantly trying just to keep up, just like physically and just with some of these things in school. And luckily we've had fantastic physical therapists and occupational therapists and speech therapists. And he really tries so hard. He is currently, he's 11 and he really wants to be able to do push-ups. And so he practices on his own, and he has I have a younger son as well, and who's 8, and these things are not hard for him. And so he'll sit and he can do push-ups, and my son is just everything that he's always trying to struggle to do it and to get there. And so, again, having these, I think, early interventions and having the diagnosis, and then also having that support structure within the schools to be able to assist and do that has been really helpful. But again, the amount of paperwork, the amount of insurance calls, the phone calls, all of those things, it's just, it can be a full-time job. But I'll pass it over to Elizabeth.
Yeah. Well, thank you so much, Alex, for sharing all of that. Yes, Elizabeth?
I just wanted to speak just a little bit on, it was easier, I think, to maybe integrate some different interventions when the kids were younger, because they don't feel perhaps that they have a say. And as my kids have gotten older, they have felt that they needed some sense of control a little bit over what they're experiencing. We also have done growth hormones for my daughter, and we actually took a break for a year because it was taking a huge toll on her mental health to be administering shots to herself, because she had to do it herself, right? So I think it's just, different things that we can integrate if they can be given in a smoother way, or they're not as, it's weighing that risk versus benefit for anything that we do for our kids. So it can have a great benefit, but at what toll does it take on our kids as they turn into young adults as well?
Yeah, no, very interesting. And I think that's the first time we've heard about, giving injections, that route of administration being itself a burden, and particularly for children who have to do, self-administer. So I'd like to now, before we broaden to our final topic, check in with Susan. I think we've been getting some comments around some of these treatment failures and downsides. What are we seeing on the web?
Yeah, thanks, James. So Logan reached out to share that medication works well to regulate blood pressure, but it doesn't tackle quality of life issues. We always have to balance the reason for the medication and the potential adverse effects on the kidneys or liver. Kai from Arizona shares, would like the ability to be in public without a big risk to immunity, specifically talking post-transplant. And then finally, Allie in Alabama, trading one chronic condition for another, ARPKD to transplant. A transplant is not a cure. Multiple transplants are likely needed, and you introduce the risk for rejection and cancer.
Well, thank you everyone for weighing in on current treatments. I do want to make sure we spend some time this afternoon now switching gears and looking towards the future. And I think we can all say that we want a complete cure for ARPKD, but knowing that there might be treatments that come along in the pipeline. And before we get to that point, we want to understand from you what your treatment priorities for, or if these treatments were to come along, what would be important to help you determine whether or not to try a new treatment. So for the last time today, we're going to go to polling questions. So again, go to pollev.com/ARPKD. And for our patients and caregivers, at this point we want to know, short of a complete cure, what specific things would you look for in an ideal treatment for ARPKD or related conditions, and select the top 3. So the options here are A, to prevent kidney disease progression, B, prevent liver disease progression, C, delay the time or avoid dialysis or transplant, D, decrease spleen enlargement, E, help with fatigue, F, increase immunity, G, reduce other symptoms, or H, some other treatment goal that's not otherwise listed here as a response option that represent a top 3 specific thing that you would be looking for in a future treatment for ARPKD and the related conditions. So we'll give everybody a few moments here to answer this question. As it stands, it looks like the top 2 responses are to prevent kidney disease progression and to prevent liver disease progression. Second to those 2 is delaying the time or to avoid dialysis or transplant. We do see decreased spleen enlargement as well as help with fatigue listed as some other top 3 treatment goals for this audience here today, with nobody reporting increasing immunity. And just like that made me a liar, we have somebody at least mentioned increasing immunity as a top 3, with no one reporting to reduce other symptoms or other treatment goals that weren't listed here. So we want to hear from you about what you picked and why you picked that, and really to dive maybe a level deeper and to say what specifically would be meaningful for you in terms of a treatment that, for example, prevents kidney disease progression. You know, what degree of progression needs to be prevented or slowed? You know, what would your kind of metrics for success be? So I'd like to come back here to our panel and invite them to weigh in here on this question. So here I'll take volunteers who would like to get us started on this topic of what it is you'd like to see from future treatments. And just give me a little wave of a hand. All right, Ashley, why don't you kick us off?
Sure. One of the things that I'd really be interested in is decreasing the progression of varices. That's something right now that we're doing endoscopies now multiple times a year, because each time we've had one, they have found them. And so that it's not only something that's difficult and risky to do, but it's also emotionally upsetting to my daughter, and it's scary because she now that we've had a few, she knows what's involved. The hospital stay is uncomfortable and upsetting for both of us, and really scary. And so that's something that I would be really interested in seeing.
Yeah, and you said kind of reduce the number. Is there, I mean, would any reduction in them be important or valuable?
Oh.
Yeah.
Yeah, absolutely. We've had 2 endoscopies so far. The first one, they found one that they banded. The second one, they were able to band one really large one, but that made it them unable to get the second one. And we'll have a third endoscopy this fall, which I anticipate they will take care of at least the one that they missed before. And so what we've been told is that as long as they're there, they'll continue to band them and they'll continue to do the endoscopy. So it's kind of a never-ending outlook for us until something happens that causes us to take the next step, whether that be transplant or shunt or whatever that may be.
I see. Thank you for explaining that to me, but also very, very valuable, important to hear. We'll just go around here. Alex, what would you say is your kind of top treatment goal? What would you like to see, from a future treatment?
I would love to see something that just slow the progression of the cysts. So in both kidney and liver, I think that would be ideal. If I could have anything on my wish list, there are just so many things I think we could probably ask for, so I'm going to try and limit. But I wish there was something to, like, there are so many new moms that we meet, or pregnant women that, you know, type into the Facebook page and they're like, what do I do?
Yeah.
What can I ask my doctor for? And I wish that there was something we could say, go ask your doctor for this.
I see.
We give them certain, tips and things to look at, like steroid shots and things, but something that we could give them to hang on to, I think would be amazing. And then just also as we look forward and towards what other people have experienced as the disease progression goes on, I'm just so hopeful that the medical community will be able to progress where, they can make him his own kidney out of his own stem cells. And I mean, as much as that was science fiction many years ago, they're talking about this in real world. And I need his kidneys and his liver to hang on for as long as they can just make him a new one.
Right.
And replace them. And so those are the kind of things that I think anything that just extends his native kidneys and his native liver for as long as possible so that the medical can catch up would be great.
Absolutely. Thank you, Alex. I'll come to you now, Elizabeth, to weigh in on this same question. What is a top treatment goal for you all?
I think for our family and where we're at in our kids' stages of progression is not to minimize the kidney side at all. We felt like we had a really good understanding of that, and then the liver stuff hit. And there's different things like dialysis and that can prolong that, but the liver, it's so terrifying. Like I mentioned before, my daughter's 13. Our son has kind of followed similar course as she has, but she was listed for a dual transplant when she was 5. She stabilized because we put another medication in, a prophylactic one, and along with the Ursodil, which I know somebody else mentioned as well, to help kind of manage and mitigate any symptoms that the liver, has. So I think if we could have more understanding and more treatment to prolong the ability to have our native organs like liver as well as kidneys, but the liver it just terrifies me, to be honest.
Sure.
But so that's what I would love to see. But also, like Alex mentioned too, just the hope that we can say, yeah, these are standards of care and treatments that can help just maybe prolong or just give some of these moms just the hope, right?
Yeah.
It's awesome to see so many older people like Shauna, who joined earlier too, and even kids who are in their teens and 20s. So I just that would be my hope.
Yeah. Well, thank you so much, Elizabeth. Lisa, as we're going through, I like how Alex said it, if I could wish for anything, of course, the only thing I've taken off the table is the complete cure, but anything else is fair game. So what would be on your list for future treatment?
I actually have some short-term wishes and long-term wishes. So my short-term wishes would be more clinical trials. My family has participated in the Milwaukee drug trial. We were very hopeful for that. And then it was before COVID, and during COVID, it died out for other reasons. I don't know why. I'm sure someone does. And they participated in the CHOP study with Dr. Hartung, and they also participate in Dr. Dell's studies here in Ohio. I know there's lots of people that are very willing to continue participating in studies if it's going to maybe not help our children, because we have to have a place where our research is showing us like how to finally find that cure, but we don't know what's helping and what's not. So that would be one of my short-term goals, is more clinical studies. And then another one too is, these kids go to 7, 8, sometimes doctors. And I remember one month in January, we had 15 different doctor appointments. Wow. And my poor child is trying to go to school, and she's very smart and she's such a studious person. Yeah. And she had to miss school 15 days out of a whole month. I mean, wow. We only go to school like 22 days during the month. So if it would be possible to have like a clinic put together where doctors could kind of be in the same place at the same time, that would be super helpful to kind of make these kids just, feel more of like a normal life instead of how they feel. And then my long-term goal, I think, would be, like everyone else has said, to prolong the life of the kidneys as long as possible. Or we were really interested in when they were whoever it was working on a portable kidney, but really to, create a kidney. I just read something about a pig kidney. So I'd be interested to see, if we could possibly use, I have 2 kids that have this, and I only have 1 kidney. And my husband has 1 kidney, and we have half a liver. So I don't know how we're supposed to cover all our kids with our little bit of organs.
Wow. Well, thank you, Lisa, for sharing that. Frank and Carolina, I want to give you the last word here on our Zoom panel, your goals for future treatments.
Yeah, I like what Alex said also. That's, of course, outside of, a cure would be, getting as advanced as, finding some level of prosthetic kidneys or prosthetic livers, or, it's certainly not a fantasy in our world, or certainly in our kids' worlds as they get older too. So, the more we can do to help that kind of research as our kids get older, that's more than what we could ask for. So.
Sure. All right. Well, I want to thank our entire Zoom panel for all of your contributions this afternoon. At this point, I see that we have a couple of phone callers, so I want to bring them into the conversation. I also see we have a number of written comments coming in, so we'll go there as well, but wanted to at least acknowledge all 6 of you and thank you for everything that you've contributed today. So I see we have Chris from San Antonio, Texas, who has a son with ARPKD and wants to share some of their thoughts about future treatments and treatment goals. So Chris, I would like to welcome you to the program. Are you with us?
Yes, I'm here. Good afternoon. So one of the things that I've been sort of interested in terms of potential treatment options for kids with ARPKD would be studies looking at CRISPR technology. This is ostensibly, a genetic disease, and I know they've looked at CRISPR gene editing for patients with sickle cell, patients with some of these other rare diseases like the thalassemias, which is a blood disorder.
Yes.
And seeing if there's any basic science studies looking at this. I don't know if they have rat models or animal models that they can start looking at potentially gene editing techniques to where you could deliver, a CRISPR package, essentially, like maybe with a hepatitis virus or an adenovirus or something that would go to the liver in this case, and maybe potentially alleviate a lot of the congenital hepatic fibrosis symptoms that these kids have, because the treatments aren't great, and a lot of it is just mitigating the complications that you get from portal hypertension that eventually develops, and so that's something that I think really would be very beneficial for the kids in the future that will be born with ARPKD. And then, my son has a kidney transplant now, but he definitely has a big belly, and it's definitely related to his liver being big, and his spleen is big, and, he's got a lot of signs of his platelet count is kind of trending down. We know that he's starting to develop more of the hepatic fibrosis type symptoms now. So that's something that's pretty important for us for looking at the future for not just CJ, but for any kids that will be born with this disease and going into the future.
Yeah, no, Chris, I really appreciate you kind of focusing on really the root cause, genetic root cause, and something that could have that cascade of effect across the different symptoms and health effects, so many of which we've talked about today. For your just to bring it back to your son CJ. Whether it's that type of genetic treatment or something else, what would represent something that would be a meaningful improvement for him if it were to come along down the pipeline?
Yeah, so potential, like I said, genetic therapy would be something very meaningful. The other thing that we struggle with too is, and I think it's related to his hepatic fibrosis. He doesn't absorb fat very well at all. It's almost like he's got, I'm a lung physician, and I've treated kids with cystic fibrosis, which is another rare disorder, and those kids have a lot of trouble absorbing fat as well. But CJ has a terrible time absorbing fat, and so looking at ways to see if we can help these kiddos gain weight, because that's a struggle that we have, is him having diarrhea related to not absorbing fat, and then he's got a lot of vitamin deficiencies related to him not absorbing his fat-soluble vitamins and that sort of thing. So nutritional support for him is quite important for us too.
Sure. Well, Chris, thank you so much for calling in and sharing those treatment goals and aspirations. I think very important for us to hear. We have one more caller in the queue that I'd like to get to this afternoon. We have Brittany from North Carolina, who is a recently diagnosed son, and so would love to hear from her about some of their treatment goals. So Brittany, I'd like to welcome you to the program. Are you with us?
Yes, I'm here. Can you hear me?
We can. Welcome.
Hi. My son his name's Nico. I was diagnosed. Well, he was diagnosed. I lost all my fluid, amniotic fluid, at around 7 months. So we weren't entirely sure about his diagnosis for sure until he was born. I'm still very new to all of this. He's a year-old now, but at 6 weeks he had the nephrectomy to remove the left kidney. Right now, our biggest concern is the ease of access. I live about 3 hours away from UNC, which is Chapel Hill, North Carolina. That's where his nephrologist is. We don't even have a nephrologist in the town I live in, or within about a 45-mile radius. So it's the appointments. I'm constantly driving about 3.5 hours there, 3 back. Our oldest son doesn't have ARPKD, but when I have to go to these appointments, I also have to remove my oldest from school, just because I don't have, I don't have anyone that could watch him here, or what I hope to the future, I don't even know if this is the thing or if it is possible, some type of monitor that can be worn similar to how a Dexcom is with diabetes. Something that could monitor blood pressure. Our big issue is that with Nico, we can never get his blood pressure.
Right.
Ever. Most appointments, he struggles so much that they don't think the reading is accurate. He is on enalapril for the blood pressure. However, we don't always know what it is. I've tried to do it at home. He's so tiny. He kind of fights it, and he's not having fun with that. I do give him a weekly shot of Procrit, but we just don't have a lot of resources here.
Well, that's really, I think, important for us. Yeah, I think that's really important for us to hear and know. Successful treatment is related to being able to monitor and make those treatment decisions. So I think we hear you loud and clear in terms of having the right tools available, even if you're not located geographically close to a clinic that can do that monitoring, but to allow you and your care team to have that opportunity and availability. So I really want to thank you for calling in and sharing that, Brittany. I want to give the final word to those individuals who have been writing in. I see we have a number of comments related to preferences for future treatments. So Susan, what do we see here?
Yeah, thank you, James, for that. Katie in Texas shares, I think a huge help would be something that would slow or preferably stop the progression of the disease and its impact on other organs. Consistent with that, Michael would like to see success in keeping the kidneys functioning without a need for transplant. Shauna in Morgantown, West Virginia shared, I would like to see a treatment that targets and slows the progression of the liver disease, as well as ARPKD in the kidneys. In addition to new medications, I would like to see more research and information on what particular diet and lifestyle changes could be. And finally, another one, Edward in Florida shares more guidance on diet, additives and specific items to avoid. Renal diet suggestions vary widely, it seems.
Sure. Well, at this point, as your meeting moderator, I just want to thank everybody throughout the entire day today for being so open and sharing so much of what it is to live with this condition and your experiences with treatments. At this point in the agenda, we do have to wrap up and close the meeting. But just before we did that, I just wanted to thank you sincerely, for opening up. I know it's hard to talk about yourselves and for so many of you, your children and what they're going through. I did hear multiple messages of hope, though, hope from the shared community that exists and the sharing of knowledge and information across members of this community, as well as hope for the future from what you're looking for from treatments. But we wouldn't have been able to, we're not able to help and hopefully progress new treatments for this disease without first, understanding the disease and what's important to patients. And so for that, I thank you all. At this point, I will introduce our speaker who will be providing summary remarks, my friend and colleague, Larry Bauer. Larry, this is an impossible job to try to summarize all of the input we received over the course of hours today. But I know Larry is the perfect person to give us a summary. He started his career as a nurse at the Cleveland Clinic, spent 17 years in clinical research at the National Institutes of Health, went to the FDA where he co-founded the Rare Diseases Program, where he worked for 10 years. And since leaving FDA and in private practice has been a true champion for these PFDD meetings. So Larry, without further ado, I'll pass it to you.
Thanks so much, James. It's a pleasure to be here. And as James said, I will try to summarize the meeting. I apologize in advance if I've missed any points that were important to you, but this is kind of a high-level overview of the meeting. So today was opened by Susan Bushnell, the president and CEO of the PKD Foundation. It was followed with a presentation from Dr. Kirtita Mistry from the FDA, from the Office of Cardiology, Hematology, Endocrinology, and Nephrology in Cedar. Dr. Mistry shared that PFDD meetings provide insights to the FDA to learn from the experts, the patients and caregivers of people living with ARPKD, and to help them facilitate treatment development, to design clinical trials, and to review new drugs developed for ARPKD. She also said that FDA is eager to hear from this community and that they are here today to listen and learn. This was followed by a clinical overview presented by Dr. Aram Hartung from the Children's Hospital of Philadelphia. She shared with us that ARPKD is a rare disease with approximately 1,500 children and young adults in the US. It can be diagnosed prenatally or later in life, and the severity of kidney and liver involvement, it varies widely with many different gene mutations. Symptoms can include enlarged kidneys with cysts, feeding difficulties, underdeveloped lungs, high blood pressure, and risk of urinary tract infection and hyponatremia. Congenital hepatic fibrosis includes dilated bile ducts, liver fibrosis, portal hypertension, enlarged spleen, and esophageal varices. This is a progressive and chronic condition and has a 15 to 30% mortality rate in infants diagnosed perinatally. Then we heard from a panel of 5 people talking about ARPKD and the symptoms and impacts. The first person we heard from was Lisa, who has 2 daughters, both affected by ARPKD, Jana and Chelsea. Jana had symptoms starting at age 2.5 months, including urinary tract infections and fevers. By age 3, she had enlarged kidneys the size of an adult's and liver fibrosis. She has fatigue and body pain, which limits her activities. Chelsea also has enlarged kidneys and has limitations in her activities and diet. Next, we heard from Lindsay, who has a son, Stephen, that was discovered to have ARPKD during a prenatal ultrasound showing enlarged and echogenic kidneys. The kidneys impaired his breathing, and he had a double nephrectomy at only 6 days old and started peritoneal dialysis and didn't walk for a year. He had a transplant within a year, but struggles now at age 12 with anti-rejection meds, adrenal insufficiency with short stature, and ADHD. Kelsey has a son, Kai, who was diagnosed prenatally with a poor prognosis for survival. He was on a ventilator for a month. He had excessive vomiting and chronic itching, which required him to wear gloves to prevent him from breaking the skin. They had a long wait for 2 years until he received a kidney and liver transplant. Next, we heard from Beth, who's mom to Eric, who was born with ARPKD and sadly died from complications around age 10. At birth, his barely functioning enlarged kidneys impaired his ability to breathe, and he had a kidney transplant at only 13 months. He had ascites and eventually developed post-transplant lymphoproliferative disease as a result of immunosuppression, and his advanced liver disease made it so he could not tolerate chemotherapy. And then we heard from Julie, who has 3 children and her 2 sons. 2 of the sons have ARPKD. Her second child, Porter, died from complications of ARPKD and lived only a few hours after birth. This loss helped inform them that their third child, Jameson, also had ARPKD, and he was diagnosed at 23 weeks of gestation. His abdomen was enlarged from his enlarged kidneys. He had a seizure at 16 months and has had fevers. He's followed closely now to monitor for changes in his kidney function, and he has to be much more careful than his peers when playing. So we heard that in the morning that ARPKD symptoms identified as most impactful were the high blood pressure, kidney failure, liver problems, fatigue, anxiety, and depression, and that some families have multiple affected family members. We also heard that ARPKD impacts playing sports, school, and socializing with friends. After our noon break, we heard a treatment overview from Dr. Max Liebau from the University Hospital of Cologne in Germany. He shared with us that this is a rare disease and it's hard to study and because of the clinical variability. He talked about some of the risk factors for early dialysis dependency in ARPKD and said that a detailed knowledge of the disease course and risk subgroups is essential. New treatments may need to independently target the lung, kidney, and liver disease aspects of ARPKD. And he mentioned the PKD Outcomes Consortium, which is a collaborative effort to find clear regulatory pathways for potential new treatments. And he also said there are 2 trials with tolvaptan to be launched to study its effect on kidney disease. Then we heard from a panel in the afternoon who talked about their perspectives on treatments for ARPKD. We heard first from Shauna, who's 20 years old and was diagnosed initially with an enlarged spleen, which required careful monitoring of her activity to protect her spleen. She's had to have banding surgery for esophageal varices and takes vitamin K for clotting. She also has had a splenectomy and takes medication to control her platelets. She's in a research study that focuses on imaging to see how ARPKD progresses. And she hopes that there are new treatments that will be safe for people with liver disease. Next, we heard from Jordan, who has a 9-year-old son, Hugo. He's taking growth hormone. He had a kidney transplant from his mother at age 4. They worry about him taking his daily anti-rejection meds as he gets older and when he's a teenager. They also worry how long his new kidney will last and if he'll need a liver transplant. They would like to see a new treatment that slows disease progression. Next, we heard from Michelle, who has 3 sons, and 2 of them, Max and Gabe, have ARPKD. They participated in 4 research studies. They've done numerous tests and scans as part of these studies and want to help find better treatments for ARPKD. They eat a low sodium diet and try to drink a lot of water. Max has tried acupuncture, and they wish there was a medication that would help kidney function stay stable. Next, we heard from Colleen, whose son was diagnosed prenatally with low amniotic fluid and had a very poor prognosis. He had to start antihypertensive medication at 3 weeks old for a blood pressure of 200/100. These meds had to be titrated at home. He needed speech therapy since he still did not talk at age 2. He wore a spleen guard while he was playing outside. He had acute renal failure at age 23 and had dialysis and then a kidney and liver transplant. These organs eventually failed and he had to have a second kidney and liver transplant and is now in his 30s. and she wishes there was more focus on treatment development for congenital hepatic fibrosis. Ashley has a son, CJ, who was on a ventilator and coded twice as an infant. He had non-invasive respiratory therapy and needed tube feeding and dialysis. He's had a double nephrectomy with worry that he would survive the surgery. He had a kidney transplant from Ashley at age 16 months, and he still has liver problems, and they worry about the eventual need for liver transplant. And their wish is that there were more treatments to slow liver disease progression. So overall in the afternoon, some of the themes, people said that treatments are only somewhat helpful. People are using high blood pressure medications, dietary modifications, and low sodium diets. Transplant is a treatment, but leads to other health issues, and benefits are not always sustained. And people overall would like to see a disease-modifying treatment and something that would slow progression, both for the kidney disease as well as liver disease. So thank you very much. And now to close the meeting, let's go back to Susan in the studio.
Thank you for your thoughtful summary, Larry. This has been an incredible day and has helped us all better understand ARPKD, CHF, and other related complications. Together, we have highlighted the impact on patients and their loved ones and the need for novel and effective therapeutics and interventions. Thank you to the FDA staff who tuned in today. And thank you to Shannon Sparklin, Ethan Gabor, Lena Merzog, Will Llewellyn, and others from the FDA's patient-focused drug development staff who guided us through this process over the many months of planning. And also, thank you to Larry Bauer and James Valentine from Hyman, Phelps, and McNamara. Their assistance in planning and moderating today's meeting has been invaluable. Thank you to the Dudley Digital Works media team for the production planning and all of the behind-the-scenes work that they have done today. And a big thanks goes to the PKD Foundation staff, supporters, and advocates who have given countless hours to the planning of today's meeting, including, but not limited to, Elise Hoover, Nicole Haar, and the PKD parents community. Also, thank you to the members of the PKD Outcomes Consortium at the Critical Path Institute, Wendy Vangasco and Soren Fidalis, who helped with meeting planning. And finally, a huge thank you goes to you, our ARPKD community of patients, parents, and families. Thank you for honestly sharing your lived experiences with ARPKD. This meeting could not have been as impactful without each and every one of you. In the coming weeks, we'll compile all the information from today, including polling data and comments, into a Voice of the Patient report, which will be available on the Foundation's website. The form to submit comments for the report is open on our website now at the same link you are on for another 30 days. Please consider submitting additional comments, which will be added to the Voice of the Patient report. A recording of today's program will be available on demand immediately following this meeting, again, at the same link you are on now. Today's meeting will have a lasting impact on the future of ARPKD research and medical product development. So once again, to the entire community, thank you for making your voices heard today.